Have you ever had a small ache or a strange sensation in your body that instantly made you think that something was seriously wrong? That's what health anxiety does. It takes something small and ordinary and it turns it into hours of worry. In today's video, I've put together a number of previous videos I've done on health anxiety, and I want to talk about tools that you can use to better manage symptoms of health anxiety now and in the future. We're going to look at models of understanding what health anxiety is and why it happens. And we're going to talk about how to not get stuck in the endless checking, reassurance seeking, or Googling symptoms that you often see in health anxiety. Instead, we're going to talk about how to challenge those patterns and to build healthier ways of responding. It's not about ignoring your health, it's about learning how to stop health anxiety from running the show. Think of this as a complete guide. Each section can stand on its own, but together they give you a fuller picture of how change happens and how recovery from health anxiety is maintained. I don't expect that you'll watch this video from beginning to end in one sitting, but hopefully it's something you can come back to over and over again to help you better understand health anxiety and what can be done to manage it. This is by far the most comprehensive and detailed guide on managing health anxiety that you'll find anywhere. And by the end of this video, I hope you'll have a clearer picture of what happens in health anxiety and what you can do about it. So with that background, let's start talking about health anxiety. Now, there are a variety of different terms that are used for health anxiety. The most common of which is hypochondriasis. More recently, it's been referred to in the actual diagnostic term has been changed to illness anxiety disorder. But regardless of what it's called, at the core of it, health anxiety is associated with a preoccupation around having or developing a serious, undiagnosed medical illness or disease. Illness anxiety disorder is not the anxiety that a person might have if they were actually diagnosed with a serious medical condition like cancer. It's the anxiety associated with the fear of potentially developing cancer or fear of having cancer that hasn't yet been diagnosed. In health anxiety, physical symptoms of an illness are typically not present, or if there are any physical symptoms present, they tend to be very mild in intensity. So for example, I might be experiencing headaches and fear that the headaches are a sign of a brain tumor. But the headaches tend to come and go. They're not associated with any other problematic symptoms that might indicate some underlying neurological condition. And the headaches only seem to come up when I'm under stress or when I haven't drank enough water that day. So it's very transient or mild symptoms. But one of the key points in health anxiety is that the person's distress and anxiety isn't related to the physical complaints themselves, but rather the anxiety relates to the meaning or the significance or the interpretation of those physical complaints. So it's not so much that I'm anxious or worried about the occasional headaches themselves, but more so my anxiety is about my perception or my belief that the headaches are a sign of some more serious neurological condition or some type of brain tumor. And associated with the health anxiety tends to be a preoccupation with my health condition or the perceived underlying disease that I believe I might have. So I might start researching symptoms of the condition online or go down the anxiety-provoking rabbit hole of information gathering about all of the horrific symptoms and outcomes that may happen to me because I have this undiagnosed brain condition, this undiagnosed health condition. I might become easily alarmed or scared by hearing about someone else having developed the condition that I'm worrying about, or reading health-related news stories about that condition. The interesting thing about hypochondriasis or health anxiety is that the concerns and anxiety about the undiagnosed disease don't really seem to respond to evidence that there's nothing serious at play. So, for example, medical reassurance from a doctor, or negative diagnostic test results, or having mild or passing symptoms don't tend to result in any lasting relief or reduction in my health anxiety. A person with health anxiety may seek out medical advice or assessment from their doctor, but then the doctor's attempts to reassure the person actually serve the opposite person. The medical attempts to reassure the person actually serve the opposite purpose, often making the anxiety and the preoccupation about the symptoms or the fear of the disease worse. The anxiety about health becomes the primary focus of the person's life, affecting their day-to-day activities and becoming almost like becoming a part of the person's identity and self-image. For people with health anxiety, they focus excessively on the perceived health condition, and it becomes a frequent topic in their social interactions with others, as they frequently seek reassurance from family and friends. But as you might imagine, this can contribute to problems in these relationships because the worry about the health becomes such a constant focus in all of their social interactions. The person's incessant worrying can become a source of frustration for friends and family and can cause considerable strain in these close relationships. People with health anxiety will also engage in excessive health-related behaviors, like repeatedly checking their body for signs of illness. So, for example, if I'm concerned about having throat cancer, I might repeatedly look at my throat in the mirror, touch it or probe it to check for signs of pain. Or I may engage in repeated swallowing to see if I notice any changes in my swallowing. Now the thing is, ironically, these behaviors can often lead to increased symptoms, which can then make my anxiety or worry about my health much worse. If I keep probing and touching my throat, chances are it's going to feel more sensitive and tender over time. If I keep swallowing repeatedly, this results in greater difficulty swallowing, which then might fuel my anxiety about why am I having difficulty swallowing now. In some cases, the health anxiety can lead to maladaptive or unhelpful avoidance of certain situations. For example, if I'm worried about my health, I actually might avoid visiting a family member or friend in hospital because just being in the hospital might be too triggering or anxiety-provoking for me. And this sort of thing can be difficult for family members to understand, and these behaviors might come across as uncaring. The health anxiety can also lead to avoidance of activities that might actually be beneficial to my health. So, for example, if I'm concerned about having a heart attack or a stroke, I might avoid exercise for fear of potentially triggering a heart attack or stroke, whereas that exercise is actually preventative and protective for me but because I'm avoiding the exercise, it actually puts me at increased risk. It's not uncommon for people with health anxiety to seek out medical care more often than other people. Most people with health anxiety have a history of extensive medical care and medical visits, but are often dissatisfied with the medical care they've received, or they're dissatisfied with the answers that the doctors are giving them. People with health anxiety or hypochondriasis often consult multiple physicians for the same problem and pursue repeated diagnostic tests, even if the diagnostic tests are coming back negative for any disease. So they're constantly seeking these second opinions or second diagnostic tests. Now, occasionally, a negative diagnostic test can give the person, the negative diagnostic test result can give a person a brief period of relief. But then the person begins to worry that maybe the diagnostic test wasn't done properly, or maybe it missed something, and then they feel that they need to repeat the test just in case. And sometimes this excessive medical attention seeking can lead to a paradoxical worsening of anxiety, as the medical attention seeking becomes a safety behavior, which just serves to make the anxiety worse. And if you're interested in learning more about how safety behaviors make anxiety worse, I've done a number of videos about this, and I'd encourage you to take a look at those if you're interested in learning more about the role of safety behaviors in anxiety, not just in health anxiety, but other anxiety conditions as well. Additionally, though, back to medical attention seeking, the excessive medical attention seeking can lead to new symptoms or medical problems, and these are sometimes referred to as iatrogenic complications. So, for example, I may have some concerns about some gastrointestinal symptoms that I've been having, and this might result in me getting a colonoscopy. And colonoscopies can be a very invasive procedure, with side effects being things like belly pain, bleeding, bloating, or infection. And these symptoms can then serve as a further source of anxiety, further symptoms for me to now worry about that were actually caused by the colonoscopy. And finally, people with illness anxiety disorder tend to be generally unhappy with the medical care they receive, and they find it unhelpful or invalidating. They can often feel that they're not being taken seriously by their doctor, and at times these concerns may actually be justified. Sometimes physicians dealing with individuals with health anxiety can become dismissive, assuming that every complaint the patient presents with is due to their anxiety, and they may not investigate the complaints or the concerns fully. Additionally, this can also lead to challenges in the doctor-patient relationship, as the doctor can become increasingly frustrated with the repeated reassurance seeking of the patient, leading to the person with health anxiety perceiving that their doctor might not be treating them adequately, and therefore they need to seek advice from other doctors. And this results in something we call doctor shopping. We might have worries about our health, and much of the time seeking medical advice and appropriate health checks are reasonable and even necessary to do. So when does this become a problem? When does it cross over from reasonable, rational concern about my health to being health anxiety? Well, there are a number of distinguishing factors between typical, reasonable worries about your health versus health anxiety worries. Health concerns become problematic when they're excessive, when you find yourself worrying a lot about a particular health concern and have difficulty focusing on other things. Secondly, health anxiety worries tend to be out of proportion to the realistic likelihood of having an actual or serious medical problem. So, for example, I might find myself worrying excessively about some exceedingly rare condition based on information that I've looked up about some of the symptoms that I'm experiencing. This is another important characteristic of health anxiety worries. The worries tend to lead to unhelpful and anxiety-provoking behaviors, such as excessive checking, reassurance seeking, or avoidance behavior. I may engage in repeated checking to see whether that bump has grown or changed since earlier this morning. I may repeatedly seek reassurance from family or friends that everything's okay. I may make repeated appointments with my family physician to get reassurance that I'm healthy and everything's all right. Now, alternatively, I might avoid any health-related information. I might avoid going to see the doctor because I'm concerned about potential negative news that the doctor might give me. So even though it might be appropriate to see the doctor, I might avoid it because I'm afraid of what the doctor might say to me. Now, all of these unhelpful behaviors tend to promote and perpetuate health anxiety, as they tend to keep our focus on the possibility that there's something seriously wrong, and we're behaving in a way to suggest that there is something seriously wrong. Health anxiety worries also tend to be quite persistent and I call sticky. So even if I get a negative test result or reassurance from a medical professional, from my doctor, I still worry about it. So even though I get that scan that suggests that there's nothing to be concerned about, it may give me a temporary sense of relief. But then I find myself a few days later worrying that maybe they missed something on the scan. And the final factor that tends to distinguish health anxiety worries from your typical health worries is that health anxiety worries, because they're so excessive, because they're so disproportionate and persistent and lead to all of these anxiety-driving behaviors, health anxiety worries can cause significant distress and interfere in a person's ability to do their day-to-day activities. So it's at that point that the worries about health cross over into health anxiety. Now, one of the things clients will often tell me is that this isn't all in their head. They have real symptoms that they're concerned about. And in some cases, health anxiety can exist in people who are perfectly healthy, don't have any significant physical symptoms, but they worry about benign or very mild symptoms. But there's other cases of health anxiety which can occur in people who are experiencing real but unexplained medical symptoms. So the person's experiencing physical symptoms that become the center of their focus that their health anxiety revolves around. Now the thing is, whether or not there are actual symptoms present or there are concerns regarding benign or mild symptoms, the key factor that tends to drive health anxiety isn't the presence of the symptoms, but it's more how a person responds and copes with their perceived or actual physical symptoms. So even if you have physical symptoms that have been unexplained or are there that they don't know why they're there, if you respond with excessive and persistent worrying, checking behaviors, reassurance seeking, or avoidance behaviors, the health anxiety may still be a problem even if there are underlying symptoms present. So, with that deeper understanding of some of the features of health anxiety, what I want to do is talk about some of the negative ways in which health anxiety can impact a person's life. Health anxiety can affect relationships with family and friends, as the more time a person spends worrying about their health or making appointments and seeking medical attention, this impacts their ability to socialize or engage with what's going on with their family. Health anxiety can lead to family and friends joining in with the worry and leading to everyone feeling anxious and concerned about what might happen. Now, alternatively, family members and friends, they might get progressively more frustrated with a person's worrying, especially if the person's had a number of negative test results or ongoing reassurance from their doctor, but they're still worrying about it. This can start to annoy family members. And so, as a result, they might respond in less supportive ways, which may lead the person with health anxiety to feel let down or disappointed or angry towards their family and friends for not being supportive and not understanding what they're going through. So therefore, health anxiety can lead to significant disruptions and conflicts in relationships with close friends and family. You can also negatively affect your relationships with your doctor or health professionals in health anxiety. So the repeated reassurance seeking or appointment making can lead to both you and your doctor feeling frustrated because you're not feeling reassured with the reassurance that they're giving you. You might start to feel that your doctor doesn't believe you or isn't taking your concerns seriously because they've labeled you as a hypochondriac. And this can lead to a deterioration in trust with your doctor and the medical system more generally, which then just makes the anxiety worse. Health anxiety can also have a negative effect on a person's work or schooling. The person could find it difficult to stop worrying and checking for signs of illness or disease. And all of this worrying can negatively impact concentration and focus. And the repeated visits to doctors and medical appointments can take up a lot of time that the person would have otherwise spent studying or doing work activities. The person may need to take time off work to attend medical appointments, leading to decreased efficiency and performance at work, which can then lead to frustration on the part of their employer. Health anxiety can have a major impact on general life enjoyment and satisfaction. Think about it. If you're constantly worrying that you have a serious medical condition that's going to significantly impact your functioning or is going to kill you, it's going to be hard to enjoy things in life. Additionally, in some cases, you might become so focused on your health concerns and health anxiety and seeking reassurance or certainty about your health that you might stop doing some of the things that you used to enjoy doing or which gave you a sense of purpose or achievement. Things like exercising or socializing. So as a result, what happens is the person begins to withdraw from meaningful life activities, and this contributes to dissatisfaction, depressed mood, reduced opportunities for enjoyment, and disconnection from other people. Health anxiety can take a toll on finances. As I mentioned earlier, if people have to take a lot of time off work to attend multiple medical appointments or consultations, this can result in limiting income or even their career attainment. The person may choose to pursue medical investigations or second or third opinions that might not be covered by insurance. And they may pay out of pocket for these investigations or pay out of pocket to get investigations and exams done faster. Things like seeking out a private MRI. And sometimes the worry, the checking, the reassurance-seeking behaviors, and the health anxiety become so overwhelming and time-consuming that a person has to stop working altogether. So there can be some real significant financial impact of health anxiety. And finally, health anxiety can actually contribute to unpleasant and uncomfortable physical symptoms associated with the anxiety itself. The health anxiety can trigger a person's fight or flight response, which can contribute to another of physical symptoms like restlessness, muscle tension, difficulty relaxing, sleep problems, heart palpitations, feeling your heartbeat, fatigue. These physical symptoms then become an additional potential source of anxiety as the person then begins to start worrying about these new physical symptoms and what they might mean, not necessarily relating the physical symptoms to the anxiety about their health. So health anxiety is sort of like being stuck in quicksand. The more you seek reassurance that everything is okay, the more it just compounds the anxiety and makes you feel worse, sinking you deeper and deeper into the health anxiety. Health anxiety is excessive, disproportionate concern or worry about your health that contributes to high levels of anxiety and sometimes feeling that fight or flight, panicky type response. So where does it come from? Why do some people develop health anxiety and others don't worry about their health at all? Well, the first set of factors relates to negative experiences that people may have had with regards to illnesses or their health. These negative health experiences can include things like developing or experiencing a medical problem yourself. People will sometimes think that health anxiety involves a person just making up or imagining that there's something wrong with their body, but sometimes health anxiety can occur because the person is actually experiencing a medical condition, which then gets magnified to be something much more dangerous or frightening than it actually is. Medical problems can contribute to us paying more attention or being more in tune with what's going on with our body. We become more aware of changes or different bodily sensations that trigger us to the possibility of other medical issues that could potentially lead to serious disease or even death. So for example, I might go see my doctor about a mole on my arm, and I'm told that it's a non-malignant form of cancer and that it's nothing to worry about and that it should be easily treated. But hearing that I have cancer triggers me to be hyper aware of other signs of potential cancer that are completely unrelated to the non-malignant mole on my arm. So I pay hyper attention to any physical sensations in my body and start to wonder whether or not they might be signs that I have cancer. Additionally, when doctors initially explain a new diagnosis to a patient, what they typically do is review all of the potential risks and complications of the diagnosis. That's appropriate, but this can lead to all sorts of anxiety as the person now becomes aware of information about risks and complications that they'd never known before. So now, this isn't to say that doctors shouldn't tell patients about potential risks and complications. But for someone who is prone to being anxious about their health, this type of information pours fuel on the anxiety fire. Additionally, in some cases, having a medical condition such as a non-malignant mole can potentially increase the likelihood of a person developing more such moles in the future. If I'm alerted to that fact, now I'm going to be even more hyper-aware of the risk of developing new moles. So what ends up happening is I start to focus on all of the potential risks and complications and the possibility of recurrence of the condition. And if I focus on it, I think about all of the ways it can turn out badly. I think about all of the different ways it might affect me in the future. What do you think that's going to do to how I feel? Well, it's probably going to make me pretty anxious about my health and the possibility that something bad is going to happen. Another example of negative health experiences is having a family member or someone close to you experience a serious illness. This is especially notable for children or adolescents. So for example, for a young child or teenager, to see someone they care about go through a serious illness, potentially experiencing pain or suffering, this can have a significant impact on how they view health and illness more generally. If we care about someone who we watch deteriorate with a progressive illness, that can contribute to feelings of helplessness and a sense of there's nothing I can do if I'm ever in that situation. This can lead to a belief or a perception that an illness means that there's nothing that can be done, and that all illnesses or health conditions are going to lead to these catastrophic negative outcomes. And taking this one step further, the death of a loved one or a family member from a particular illness can be a significant negative health experience that can lead to high levels of health anxiety. Look, we're all going to die. That's a certainty. But for most of us, we tolerate the uncertainty of not knowing exactly when or how that's going to happen. But if we witness a loved one or someone close to us dying, it can contribute to thoughts about our own mortality and what our death is going to be like when we get to that time. And this can be extremely scary for people. This is particularly the case if your loved one has suffered from a prolonged disease or illness, such as long-standing cancer or Alzheimer's dementia, and you watch them deteriorate and potentially suffer as they got closer to death. This can lead us to relate illness with suffering, with death, and can lead to tremendous feelings of helplessness and vulnerability. Now, another potential factor that can contribute to health anxiety is having a family member with health anxiety. Again, particularly in childhood, if you have a parent or caregiver with health anxiety, they can model a lot of health anxiety promoting behaviors. And if that's all you know, you may feel that those health anxiety types of behaviors are normal or adaptive. Things like seeing your parent or caregiver constantly worry about their health, noticing them frequently checking for signs of illness, making repeated appointments to see their doctor, seeking all sorts of reassurance from other people about their health. If we grow up witnessing these types of behaviors, it's natural that we might learn that these are things we should do if we're anxious about our health. And finally, the last example of negative health experiences involves us coming across negative information about health via media and the internet. Look, the internet is a wonderful thing. It's wonderful to have access to all sorts of information. If not for the internet, you wouldn't be watching this video or hearing me talk about these factors that can contribute to health anxiety. But the internet can also be a tremendous source of information about health, health-related stories, articles about promoting health, but also information about illness and disease. Oftentimes, health information on the internet focuses on very rare diseases, incurable health conditions, or the most sensational, awful types of diseases. If I'm looking up information about a toenail fungus, I'm likely to find all sorts of articles, videos, and pictures of the most extreme and nasty toenail funguses I could ever imagine. And that information is also going to lead me down the rabbit hole of all sorts of other types of skin conditions and diseases. So what may have started out as a little bit of a search about a relatively benign toenail issue leads to me being hyper anxious about developing all sorts of awful skin diseases. So all of these are examples of negative health experiences that can contribute to a person being more aware of all of the potential negative health conditions they may have, more in tune with potential signs and symptoms that they might have a negative health condition. They may perceive health conditions to be more dangerous or catastrophic than they might actually be, and feel a sense of helplessness and hopelessness to do anything about it. And the result of all of this is that it increases my sense of vulnerability related to my health. If I witness someone I care about experience a painful disease or illness, if I had a parent constantly worrying and seeking reassurance about their health, if I know all of the potential symptoms and outcomes of various diagnoses, if I've had health conditions that I perceived lead me to be at increased risk of experiencing even worse health conditions in the future, if all of these things are going on, what do you think that does to how I view my health and well-being? I'm likely to view myself as extremely vulnerable, as I lose my perspective on the actual probabilities or severity of these health conditions. And what I focus on is the high likelihood that I'm going to experience this awful illness that could potentially lead to my death. As a result of this vulnerability, it just becomes natural that I focus my attention on my health and all of the possible body sensations and health problems that I might be at risk of. Whereas someone who doesn't have all of these vulnerabilities may just simply ignore that random physical sensation that just goes away by itself. So I like to think of this as kind of a first step in understanding why health anxiety happens and where it comes from. So if you have this heightened sense of vulnerability regarding your health, think about how that might affect you and think about how you might respond. Whenever we feel like we're in danger, it's natural to want to engage in behaviors to do something to protect ourselves. It's natural to want to take steps to be safe and protect ourselves. So if I'm feeling anxious and vulnerable about my health and the possibility that I might experience some serious medical condition, then it only makes sense for me to take some steps to try and protect myself or keep myself as safe as possible. Now, there's two common ways that people tend to do this in health anxiety. The first is developing rules and assumptions about health, and the second is increasing their sensitivity to health or health-related symptoms. So let's start by first talking about common rules and assumptions that people will hold on to that tend to make health anxiety worse. The first thing I'll say about this is that we all tend to have rules and assumptions about various aspects of our lives. For example, I might have a rule that I need to brush my teeth twice a day, otherwise I might get cavities or other dental problems. This is probably a pretty good rule to follow. But rules and assumptions are only helpful as long as they're realistic and flexible. In this example, it's fairly likely that if I don't brush my teeth regularly, I'm going to experience some dental problems. So that rule is realistic. But it's also important that the rule is flexible. So my goal might be to brush my teeth twice a day, but I also recognize that it's not the end of the world if I miss brushing my teeth once in a while. I can be flexible about that. So rules and assumptions aren't in and of themselves bad or unhelpful. They only become problematic when our rules and assumptions are either inaccurate or completely rigid and inflexible. And this is where health anxiety comes in. At the core of health anxiety, people often have unhelpful rules and assumptions about themselves, their health, the healthcare system, and medical professionals. These rules and assumptions can then contribute to high levels of anxiety about health. And these rules and assumptions are often inaccurate and rigid and inflexible. So some common examples of health rules that might contribute to anxiety are things like any bodily symptoms or changes need to be taken seriously. I have to report any unusual body sensations to my doctor. In order to be healthy, I can't have any physical symptoms. If I do have any physical symptoms, I need to have a diagnosis in order to move forward. My health rules can also relate to medical professionals. Things like, my doctor must be certain about what's going on with me, or my doctor should be able to explain all of my bodily sensations that I'm concerned about. Those are all examples of health rules. People also have a lot of assumptions about their health, including things like any symptoms of pain, discomfort, or bodily changes are signs of a problem. If I don't pay close attention to health symptoms, it could kill me. If my doctor orders a test, then it's a sign that there's something wrong. If my doctor doesn't know exactly what's going on or what the problem is, then it must be something grave and serious. If my doctor can't assure me that everything is okay, then it must mean that there is some underlying serious problem. If I don't have regular checkups or testing, I could miss something really important that's going on in my body. If I'm not hyper aware of what's going on in my body, if I'm not paying a close attention, there may be an underlying problem that could be getting worse. If I don't keep persisting or checking in with my doctor might miss something really important. So those are all examples of assumptions that can often take place in health anxiety. And sometimes people can have both rules and assumptions about their health at the same time. So for example, if my doctor can't tell me exactly what's going on, then it must be serious and I need to have further testing and further investigations. If I have a mole that I'm concerned about, I have to keep measuring the size of the mole, otherwise I won't know if it's growing or getting worse. Doctors are human, they make mistakes, they miss things, and so what that means is that I need to see lots of different doctors until I get a clear sense of exactly what's going on. Now, sometimes when I discuss these rules and assumptions with my clients, they can relate, but then question why they hold these rules and assumptions, and doesn't everyone think the same way? Now, it's important to remember that past experiences can play a role in developing these rules and assumptions. For example, if my mom was really anxious about her health when I was growing up, think about how some of her behaviors may contribute to me developing certain rules and assumptions about health. Any minor health complaint, any sniffly nose, any minor growing pain would trigger multiple trips to the doctor and lots of time worrying about it and lots of time looking up information about it, even if the doctor assured her that nothing was wrong. These types of negative health experiences and associated heightened vulnerability to health and health-related concerns set up a person to develop these unhelpful beliefs and assumptions about their health. Again, the whole purpose of these beliefs and assumptions are to try and keep myself safe, but all they're really doing is focusing on negative aspects of health, likely making my health anxiety worse. So one thing I often encourage clients to do is to think about what the rules and assumptions they hold about their health, and what are some of the experiences that may have contributed to developing these rules and assumptions. So it's important to think that through and to think about, where did these rules and assumptions come from? What might have triggered them? Now, the other thing that people do to protect themselves in the context of health anxiety is to be more sensitive and more aware of any health-related symptoms or health-related matters. And this is usually done by increasing focus and attention to a particular physical sensation that the person is concerned about. And what tends to happen is that the more you pay attention to a particular physical sensation or symptom, the more intense that physical symptom or sensation gets. For example, as you're watching this video, you're paying attention to what I have to say because that's what seems to be the most important and relevant information being presented to you at this time. What you're probably not noticing is the feeling of the shirt you're wearing, the parts of your body that the shirt is touching versus the parts of your body that your shirt is away from, the texture of the shirt against your skin, the weight of the shirt, the sound that the shirt makes as you move, the feeling of the shirt as it slides across your skin as you move. But now that I've pointed out some of these things, you might be more aware of the sensation of your shirt on your body, whereas 30 seconds ago, you didn't even notice it. Now, as you pay attention to it, the sensation of the shirt is much more intense and noticeable. Think about how this might relate to health anxiety. For most of us, we don't typically pay much attention to minor aches and pains or our general physical functioning, like our heart rate or how much saliva I'm producing or the weird creaks and cracks of my joints. We just kind of accept that our bodies are like cars, sometimes running fine, other times making weird creaking noises, but for the most part, they get us back and forth to where we need to go, and as long as we take care of them with routine maintenance. However, for someone with health anxiety, they perceive that their health is at risk, that their health is under threat. And so they increase their sensitivity to any signs of danger or threat or health problems as a way of protecting themselves. So what happens with health anxiety is the person becomes more sensitive or tuned in to any concerning signs or symptoms, and then pays close attention to those signs and symptoms in their body. And the more they pay attention to those physical sensations, the more intensely they notice, and the more intensely they experience the physical sensations, which then just triggers even more anxiety or concern because the physical sensation seems to be getting more intense. Additionally, the more you pay attention to the physical sensation, the more you notice unusual details of the sensation, and that gives you even more to worry about. For example, if I'm concerned about having throat cancer, I might pay close attention to what it feels like when I swallow. But when I pay such close attention to my swallowing, I notice that it feels a bit more challenging to swallow, almost unnatural or difficult. So what I do is I try swallowing again while paying attention to it, which just reinforces that unusual feeling that I'm noticing. But what's really going on here is that swallowing in and of itself is a bit of an unusual sensation if you actually pay attention to it. But if you're not paying attention to it, it doesn't feel like anything unusual at all. So if you notice that you're highly anxious about particular physical sensations or symptoms, think about what those symptoms are, how often you're checking on them, and how much time and effort you spend focusing on them. But also think about what you notice as you pay so much attention to these sensations, and how the sensations may actually seem to get stronger the more you pay attention to them. Now notice, it's not the sensation that's getting stronger necessarily, but it may just be that you're so focused on it. And so this is where our model of health anxiety stands at this point. In the previous video, I talked about how negative health experiences, like a family member's having an illness, the death of a loved one, negative information in the media or on the internet, how these negative health experiences can lead me to having an increased sense of vulnerability about my health. I see myself at risk that something bad is going to happen to my health. And in response to this, I attempt to protect myself and to protect my health through using these various unhelpful rules and assumptions that we talked about earlier in today's video. But I also then increase my sensitivity to signs or potentially concerning symptoms. I become highly tuned in to any signs of potential threat or danger to my health. And so all of these things lead to increased susceptibility to developing health anxiety. So these are the risk factors. These are what we call predisposing factors that can leave a person vulnerable to developing health anxiety should they experience a trigger. It's almost like these factors create a dormant health anxiety within a person, lying just under the surface. And this dormant health anxiety doesn't cause any problems unless the person is exposed to something that triggers the health anxiety and causes them to start worrying excessively about their health. I've talked about how past experiences, like previous experiences with illness themselves, seeing a family member struggle with a health condition, or having a family member model health anxiety behavior, I've talked about how these can lead a person to feel more vulnerable with regards to their health. And what this can do is to increase how concerned a person is about their health and their health status, and they become extremely sensitive to any body sensations, changes, or symptoms. The person becomes hypersensitive to any signs of potential health risk or illness. So if a person has these factors that predisposes them to develop health anxiety, this dormant condition that lies under the surface until it's activated, that raises the question of how exactly does health anxiety get triggered? What are some of the factors that can take this dormant health anxiety that's lying just under the surface and that isn't causing a person problems in their day-to-day life, and how can it become something like hypochondriasis, which causes huge amounts of distress, anxiety, and interference in a person's life? Now, to try to explain this, I want you to imagine asking a friend or family member whether they've ever worried about their health. What do you think they would say? Well, most people will acknowledge having some health-related concerns from time to time. Health is a common topic that people worry about. But for most people, the worries about their health come and go, just like other worries. Now, the interesting thing is, if you ask those same friends or family who don't experience health anxiety what factors might get them to start worrying about their health, those are probably going to be the same factors that would trigger an episode of health anxiety in someone with hypochondriasis. The difference is, for people who don't experience high levels of health anxiety, these triggers may start an episode of some worry about their health, but they eventually dismiss those worries and move on with whatever else they were doing. They move on with life. But for someone with health anxiety, these triggers get combined with inflexible and inaccurate health rules or assumptions that a person may have. Beliefs like any bodily symptom or change needs to be taken seriously. I must not have any unusual physical symptoms in order to be healthy. I have to pay close attention to my health symptoms, otherwise I might miss something and that could kill me. Those types of beliefs, rules, and assumptions become activated and flare up to pour gasoline on this smoldering health anxiety which just lies under the surface. So, in other words, for a person with health anxiety, they likely have had negative past experiences that lead to unhelpful beliefs, rules, and assumptions about their health. This is kind of like the stick of dynamite. So all it takes is that there's a little bit of a trigger or a match to ignite the dynamite and cause the health anxiety to blow up. And the thing is, this is all happening in the background. It's not that people are necessarily aware of this while it's happening. This isn't necessarily a conscious process. So that's how a person gets set up for these triggers to really affect them and cause the onset of an episode of health anxiety. But what exactly are these triggers? Well, there are two main types of triggers. There are internal triggers and there are external triggers. Internal triggers are things that happen within us. These internal triggers can be any physical sensation that you might notice in your body. So common examples of internal triggers are things like having ringing in your ears, noticing increased sensitivity to hot or cold on your teeth, stomach distress, having gas, noticing tingling or numbing in some parts of your body, noticing an increase or a decrease in your heart rate, noticing fluctuations in energy level, even things like noticing you have more saliva than usual. Sometimes you might notice new or unusual symptoms for you, things like a rash that you've never had before, or headaches if you're not used to having headaches. You may notice that one of your eyelids tends to twitch or flutter and wonder what's going on with that. But you might be wondering, where do these internal triggers come from? What's causing them? Why am I having these internal sensations or these internal triggers? The funny thing about our bodies is that they're constantly changing in a process called homeostasis. Our bodies are constantly adjusting depending on environmental factors. And so things like heart rate, for example, can be affected by outside temperature changes, which we generally aren't really paying attention to. So a person might notice a change in heart rate that was caused by it being warmer outside, but they don't really register or connect the two. The other thing is that our bodies are sometimes a lot like old cars. They get weird creaking noises or aches or funny sensations that come and go, but generally speaking, we're able to function fine, and those physical sensations don't mean anything's necessarily wrong. But imagine for someone with health anxiety. They start to notice some of these internal triggers, and these internal triggers can then ignite that dormant underlying predisposition to worry and worry about health, and then kaboom, the health anxiety blows up. Now, aside from physical sensations going on in your body, there are a number of external factors or external triggers that can get this health anxiety ball rolling. This can be things like hearing about a coworker or an acquaintance who's been recently diagnosed with a serious illness. It can be hearing about health scares in the news, various illnesses or diseases that are spreading in the community. It can be coming into contact with someone who's not feeling well and then starting to worry about whether or not you might have caught something from them. Health anxiety can sometimes be triggered by having an upcoming medical appointment. Maybe it's been a while since you've seen your doctor and they want you to come in or have some sort of diagnostic test. And this can trigger a lot of anxiety about what if there's something wrong. And if you get those medical test results and the results come back inconclusive,
which can be pretty common with a lot of diagnostic tests, this inconclusivity can also then trigger high levels of anxiety or concern. Even something like traveling overseas or being away from your healthcare system. If I'm in a different country, I might start worrying about what would happen if I got sick. Would I be able to communicate effectively with the doctors? Would I be able to get appropriate treatment? Would I be able to pay for the treatment? And sometimes these external or internal triggers can work together to make a double whammy trigger for a person with health anxiety. For example, suppose I read a news article about someone who developed throat cancer, and then I start noticing some tenderness in my throat or some unusual sensations when I try to swallow, and it leads me to start wondering if maybe there's something wrong with me. So any of these internal or external triggers can start a spiraling collection of what-if health thoughts. And once a person who's predisposed to hypochondriasis starts on that what-if worry train, it can be really, really difficult to break out of that cycle. And so this is where our model of health anxiety stands at this point. A person has a predisposition to health anxiety based on prior experiences and unrealistic or unhelpful rules or assumptions about their health. That person gets exposed to either internal or external triggers, which then activates those unhelpful rules and assumptions. Things like, I can't be healthy and have any unusual physical symptoms. If I do have any unusual physical symptoms, I need to know exactly what's causing those symptoms. Otherwise, it must be something bad. If I don't take this seriously, if I don't pay close attention to it, I could miss something, and that could lead to a serious illness or disease that could potentially lead to my death. And so the health anxiety stick of dynamite gets lit and explodes. But the thing is, people with hypochondriasis typically don't experience health anxiety as just an acute explosion of worry about their health that goes away relatively quickly. What usually happens is the health anxiety gets activated, but then there are a series of other factors that maintain the health anxiety and keep it going. So what happens once a person's health anxiety gets triggered? Does it just go away on its own? And if it doesn't go away on its own, what keeps it going? Well, there are 5 main factors that can fuel and keep health anxiety going. The first of these is unhelpful or negative thinking patterns related to a person's health. People who are prone to health anxiety have a number of unhelpful rules or assumptions about their health that get activated by various triggers. And these unhelpful rules and assumptions affect how we interpret health information. People with health anxiety generally tend to overestimate the likelihood that they have a serious health problem, and they tend to underestimate their ability to cope with health difficulties. In health anxiety, what also tends to happen is that people tend to put much less weight on information that suggests things aren't as bad as the health anxiety would suggest. So for example, a person with health anxiety may ignore their doctor's reassurance that it's extremely unlikely that they have a serious illness, but rather the person may focus on all of the negative, less likely worst-case scenario information than the chances of a cure or effective treatment. As a result, all health-related experiences are viewed in the lens of a catastrophe or a worst-case scenario. And what this does is it affects 2 broad areas. The first is a tendency for a person to catastrophically misinterpret body sensations. So for example, if I hold an underlying belief that any pain, discomfort, or unusual body changes are a sign of something serious underlying, some serious underlying disease, what this means is that when I start to notice that new pain in my joints, I may come up with a catastrophic interpretation or understanding of what that pain means. Maybe this is bone cancer. Maybe this is the start of a serious arthritic condition. This could be something incurable. Maybe it's cancer that's spread to other parts of my body. Now notice, none of these catastrophic things have happened. But the way I interpret those physical sensations is leading me to believe that these catastrophic things are likely, if not a certainty, to happen. The other thing that can happen is that people tend to catastrophically misinterpret health-related information. What this does is it leads to people feeling that they're at higher risk of something really bad happening than they actually are. So for example, suppose I've been feeling unwell for a week or so, and I know I should go see my doctor to get it checked out. So I go to the doctor does some blood work and tells me that the test results indicated that I have a low white blood cell count. But then the doctor goes on to tell me it's probably just due to the fact that I have a cold. Well, if one of my underlying assumptions or beliefs about my health is that my doctor needs to be 100% certain of what the problem is, if my doctor's not sure what's causing the low white blood cell count, then it must be really serious. So my doctor said the low white blood cell count is probably due to the fact that I have a cold, but maybe my doctor's actually wrong. And maybe what I have is leukemia, or maybe it's something that my doctor hasn't tested for, like lupus or some other autoimmune condition. So notice, what's happening is that I'm taking this information from my doctor and I'm interpreting it in a catastrophic way to make me feel even more anxious about my health. Now, the second big factor that can maintain and perpetuate health anxiety symptoms is when a person experiences an increase in anxiety symptoms themselves. Think about it. If I start to have catastrophic thoughts about my bodily sensations, I start to think that I might have bone cancer, I start to think that my doctor's not sure what's going on, and so it must be some really awful neurological condition that's going to kill me slowly. If I'm having these thoughts, how do you think that's going to make me feel? Well, those thoughts are probably going to trigger a whole lot of anxiety, which then activates my body's fight or flight reaction. My anxiety system is going to kick in, and this is going to trigger a whole set of physical responses and physical reactions. I've talked about this in previous videos that I've done on panic disorder, that our body's anxiety system is designed to make us temporarily stronger or faster to either fight a physical threat or to run away from it. So what happens when we experience high levels of anxiety is that we can experience a number of associated physical reactions. Things like increased heart rate, muscle tension, increased respiration rate, dizziness or lightheadedness, numbness and tingling in my fingers or my toes, increased sweating, hot flushes, chills, blurred vision, upset stomach, all of these types of things. Now, these symptoms or sensations are all part of the body's natural alarm system that's designed to activate us in the face of an actual physical threat. But in the case of health anxiety, my thoughts are revolving around perceived danger, not actual physical threat. So if I'm thinking that my knee pain is bone cancer and that's going to be incurable, leading to death, that's a perceived danger. It's not something that's actually happening, and it may never happen. But if I have these thoughts, it makes me more anxious, it triggers my fight or flight reaction, and brings on these physical sensations of anxiety, which now serve as other physical symptoms that my health anxiety will get me to catastrophically misinterpret. My health anxiety will tell me that the symptoms of anxiety are just another sign of something being seriously wrong with my health. And what this does is it leads to a vicious cycle where a benign physical symptom like an ache in my knee triggers catastrophic thoughts about awful health problems that I may have, which in turn triggers anxiety symptoms, which lead to even more catastrophic thoughts about my health, triggering even more anxiety symptoms, and so on, and so on. Now, the third big factor that can contribute to making health anxiety worse or keeping it going relates to focusing or paying attention to certain bodily symptoms or sensations. If I'm really concerned about the pain in my knee and the possibility that it could be bone cancer, I'm likely to spend a lot of time focusing and thinking about the pain. I may check in with it every morning to see, is it getting worse? Is it spreading to other parts of my leg? Is the pain subjectively different? Is it more throbbing pain? Is it more of a sharp pain now? The more I focus on the pain, the more I'm going to notice all sorts of small, nuanced peculiarities of that pain. I'm going to notice all of the things that I probably wouldn't have noticed if I wasn't paying so much attention to it. And then I interpret these newly noticed aspects of the pain as a sign of something bad. Now, the other thing that can happen when we focus on a physical symptom is that focusing on the symptom can actually amplify the intensity of the symptom. And if the intensity of the symptom increases, that can trigger even more anxiety about the symptom, which requires me to then pay more attention to it, which amplifies the intensity of the symptom, and now I'm in another negative spiral of anxiety. To explain this, I want you to pay close attention to what's going on in your stomach right now. Try to notice all of the little sensations that you can feel and that you can notice in your stomach. If your stomach feels full or if it feels empty, is there any tightness or gurgling sensations in your stomach? Just really try to pay attention to what your stomach feels like right now. And if you were to spend even just a minute doing this, what you might notice is all sorts of physical sensations or symptoms in your stomach that you may not have noticed before. Now, the thing is, the sensations were there all the time. They've always been there, but you just weren't paying attention to them, and so you didn't even really notice them. The moment you pay attention to those symptoms and focus on them, you begin to notice them, and the symptoms themselves seem much more intense than they were even just 2 minutes ago when you weren't paying attention to them at all. So it's important to recognize that focusing on the particular sensations or feared symptom can actually serve to make the health anxiety worse because it amplifies the intensity of the symptom merely by the fact that you're paying attention to it. Now, the next big factor that can perpetuate and drive and fuel health anxiety relates to checking and reassurance-seeking behaviors. Now, the thing is, if you worry about something, it's natural to want to check or seek reassurance about it. If I'm concerned that I might have not locked the front door, that might lead me to feel anxious. And so I go down and I check the front door. Once I see that it's locked, I feel less concerned and my anxiety goes away. So checking and reassurance seeking is pretty natural. And with regards to our health, we're often encouraged to check and pay attention to our bodies. We're often encouraged to monitor moles on our skin for any signs of change. Women are frequently encouraged to do breast exams and to get regular mammograms to check to make sure that there are no cancers developing. If we're concerned about our health or notice any changes in our general well-being, we're encouraged to reach out to our family physician just to get checked out and to make sure that nothing is wrong. So, checking and reassurance seeking, in and of itself, is not a bad thing. But it does become problematic when it starts to become excessive. For people with health anxiety, they may notice these physical sensations or symptoms and it makes them feel really anxious, and they start to worry about their health and worry about the symptom. And so the person with health anxiety engages in repeated or ongoing checking and reassurance seeking as a way of trying to reduce their anxiety or worry about their health. The hope is that each time they check or seek reassurance from their doctor and they notice that the symptom hasn't changed or their doctor tells them that everything looks fine, they feel better in the short term. But they notice the symptom again, and then it causes their anxiety to increase. And so what they have to do is to check or seek reassurance again as a way of trying to control the anxiety. So when the reassurance seeking or checking starts to take a role of trying to control anxiety, this becomes extremely problematic. You see, the thing is that we as human beings are actually pretty logical and rational creatures. It may not always feel that way, but it's actually true. What happens as a person does more and more of this checking and reassurance seeking is that they're giving themselves a message about their health. Think about it. If there was nothing wrong, if I had nothing to be concerned about, would it make sense for me to constantly check this same symptom or repeatedly go to my doctor to get a checkup about this particular symptom? No, of course it wouldn't make sense if there was nothing wrong. So you see, the act of repeated checking and reassurance seeking signals to me the message that there's something seriously wrong. And that's why I'm doing all of this checking and reassurance seeking. It's kind of faulty logic, but it's part of what the health anxiety does to make a person feel even more anxious. Now, the other thing that can happen with this is that sometimes efforts to check for an illness can actually bring on new or more intense symptoms themselves. So, for example, if I'm worried about a bump on my skin, I may poke and prod at it with my finger to see if there's any areas where it's particularly tender or any areas where it's sore. If I continue to do this, the more I poke and prod this bump on my skin, the more tender and painful to the touch it's actually going to become, which now makes me feel even more anxious because this bump that was there a week ago that wasn't sore or tender is now getting quite sore or tender to the touch. Another example is if I'm worried that I might have throat cancer, I might try swallowing to check and see if there's any pain with swallowing. And I may do this repeatedly, maybe 3, 4, 5 times. I encourage you to try it. See what happens if you swallow repeatedly for 20 or 30 seconds. What you'll notice is that the more you're swallowing, the harder and harder it becomes to actually swallow. So if I'm doing this swallowing thing as a checking behavior, the checking behavior itself is now making the physical sensation and the symptom more intense, which just leads me to feel even more anxious because now I'm having trouble swallowing. So checking and reassurance seeking becomes problematic when they're excessive and when we start using them to try and alleviate our anxiety, because the checking and reassurance seeking is likely just going to make the anxiety worse. And now the final big factor that tends to fuel and drive health anxiety relates to avoidance and safety behaviors. Avoidance and safety behaviors are different than checking and reassurance seeking because in checking and reassurance seeking, those behaviors are designed to reduce feelings of anxiety that are currently present. Whereas avoidance and safety behaviors are things that we do to try and prevent ourselves from experiencing anxiety in the first place. So we might do things to avoid all of the various triggers that I talked about in a previous video. This could be avoiding internal triggers, like anything that may bring on a physical sensation. So I might avoid drinking coffee, I might avoid exercising, I might avoid eating spicy food, or I might even avoid having sex. The idea behind this avoidance is that I'm trying to avoid bringing up any physical sensations that I might find scary or frightening. I might also avoid external triggers, such as people, places, or situations that might remind me of my health anxiety. So I might avoid seeing my doctor. I might avoid following up on test results. I might avoid watching medical shows on TV. I might avoid watching the news or reading the newspaper just in case there's a story about some health condition that I'm concerned about. So all of this avoidance is designed to eliminate or reduce the number of reminders that I'm experiencing about my health concerns. And if I'm reminded less, I'm going to feel less anxious or worried about it, right? However, there are a couple of main problems with avoidance. First of all, avoidance begins to make your life and your world a lot smaller because you have to avoid more and more things that might trigger your health worries. And the second problem with avoidance is that if you're always avoiding everything that you're fearful of, you never get a chance to disprove that what you're afraid of could actually happen. So if I'm avoiding seeing my doctor because I'm concerned that my doctor is going to give me bad news about my health, I'll never know whether or not my doctor would actually give me bad news. Maybe if I made the appointment and my doctor checked me out, my doctor might tell me that everything looks perfectly fine. But I never get that information because I'm avoiding my doctor. Now, safety behaviors are a more subtle form of avoidance. So with safety behaviors, you don't fully avoid something, but you only come into contact with it as long as you have a safety or backup plan. So for example, if I'm fearful of having a heart attack while hiking, I might still decide to go for a hike, but I'm going to make sure that I go for a hike with my friend who happens to be a physician, and I'm going to make sure that I have my cell phone with me just in case I start to have a panic attack. I'll be able to call for help. So I have my friend with me who's a physician who'd be able to help me if I have a heart attack, and if I do have a heart attack, I have my cell phone and I'll be able to call for help. So just like avoidance, the safety behaviors are just reinforcing this underlying belief and assumption that I'm at great risk of something bad happening, which just perpetuates my anxiety about my health. So it all starts with a trigger. We all experience internal or external health triggers from time to time. This could be things like unusual feelings or sensations in my throat, a new mole that I've noticed, reading a magazine article about someone who developed throat cancer, or finding out about a friend who developed some serious medical disease or illness. We experience these types of triggers all the time, but not everyone who's exposed to these triggers actually experiences high levels of anxiety about their health. In health anxiety, though, what the trigger does is that it activates unhelpful rules or assumptions that the person has about their health and what it means to be healthy and what it means to be sick. These underlying rules and assumptions can develop from a variety of different types of negative health experiences in the past. Things like having experienced a medical problem yourself in the past, having had a family member experience a serious illness, seeing a loved one pass away from some health condition, having family members who have health anxiety themselves, finding negative information about health and disease on the internet or from other sources of information. These rules and assumptions are there and they lie dormant until some trigger happens. And then the rules and assumptions become activated. It's almost like a light switch gets turned on and these rules and assumptions begin to affect how I think, how I feel, and what I do in response to the trigger. So if one of my underlying rules and assumptions about health is that I must not have any physical symptoms, signs of pain or discomfort in order for me to be healthy, or if I have a belief that if I were to miss paying attention to some important symptom, then it could kill me. So I have these beliefs. Imagine what would happen if I noticed some pain and tenderness in the side of my throat. This activates my underlying beliefs and assumptions about my health, and maybe one of those beliefs is that any sign of pain or soreness is indicative of some illness or disease. Well, how do you think I would feel? How do you think I would react if I thought those things about the pain and tenderness in the side of my throat? How would I feel every time I notice that tenderness? How would that affect what I think about what the pain and the tenderness in my throat actually means? So when the triggers interact with these underlying rules and assumptions, this places a person at increased risk of experiencing health anxiety. It's because they become much more likely to misinterpret the body sensations or the body symptoms as a sign of serious illness. They may misinterpret health-related information, and this may set off more physical symptoms, and that causes me to worry more and more about it. So I notice the pain and tenderness in my throat. I think to myself that I need to pay attention to this, otherwise it could kill me. And that leads me to start believing that this could be throat cancer. And so what I do is I go see my doctor, who takes a look at the area and says, doesn't look too serious, but let's keep monitoring it. I interpret that to mean that my doctor doesn't really know what's going on, and why would I have to keep monitoring it unless it's something really bad or dangerous? So I have all of these unhelpful and negative thoughts about my health and what this soreness and tenderness on the side of my neck means. And these unhelpful and negative thoughts trigger all sorts of anxiety. Things like increased muscle tension. My heart might start racing. I might be more short of breath or lightheaded. I might experience dryness in my mouth. I might experience dryness in my throat. These are all normal physical sensations associated with anxiety. But in this context, these physical sensations of anxiety just serve to act as another set of triggers that activate my unhelpful rules and assumptions about health and cause me even more negative thoughts about danger or threat related to my health, and it just makes me more and more anxious. So as I'm starting to feel more and more anxious, I want to do something to make the anxiety go away. I want to do something to alleviate the distress and to alleviate the discomfort of the anxiety I'm feeling. And through this process, it could feel like I'm spiraling out of control with my anxiety. And so there's three main things that I might try to do to try and get greater clarification on what's going on, or to try and make me feel less anxious or less fearful about what's happening with my health. The first thing I might do is focus on the symptoms. If I'm afraid of what's going on with my neck and the tenderness and soreness, I might be tempted to pay really close attention to all of the sensations to notice if they're getting worse, if they're changing, if the pain or soreness is spreading. I want to know all of these things. So by focusing on it, I'm now noticing every little minor change and new sensation in my throat area. I've also talked in a previous video about how paying attention to physical sensations and focusing on the sensations can actually make that physical sensation feel more intense. So think about the impact that would have. The more I'm focusing on these physical sensations, the more intense they're feeling. Do you see that the trap that the health anxiety is setting up for me? Now, the second thing I might do to try to alleviate my anxiety is to engage in checking and reassurance seeking. I might check my throat or my mouth. I may look at my tongue in the mirror. I may touch or probe and prod at the area on my neck to see if it's getting more sore or less sore. I might go onto the internet and use Dr. Google to try and find out what might be the possible underlying cause of this soreness and tenderness in my throat. I may make an appointment with my doctor to get some reassurance or to get some testing done to see what my doctor thinks is going on. And this may take multiple appointments because my doctor isn't giving me the certainty and the absolute answers that I'm looking for. The other thing I might do to try and reduce my anxiety is avoidance or engage in safety behaviors. I may start avoiding anything to do with medical information. I might stop watching medical dramas on TV or watching documentaries about health or hospitals. If any news story comes on TV that's talking about cancer, I'll change the channel because I don't want to hear about it. I might avoid any places that I might get sick out of fear that my immune system has been compromised by whatever's going on in my throat. I avoid all sorts of things to try and stop the worrying about my health. So let's think about what happens if we engage in these types of behaviors to try and reduce our anxiety. We hyper-focus on the symptoms. We check them a lot and seek reassurance about them. And we engage in avoidance and safety behaviors related to the physical sensations and are concerned about what they mean. In the short term, what this does is it gives me a temporary sense of relief or control over the symptoms. If I see my doctor and my doctor says, at this point, it doesn't look like it's anything serious, it's probably just an inflamed lymph node, no big deal. That may give me a little bit of sense of relief in that moment. But then I start to think about, what did my doctor mean by using the word probably? So the short-term relief from the anxiety by engaging in these behaviors is temporary and tends to be short-lived. But what are the long-term effects of these anxiety-reducing behaviors? What are the long-term consequences? Well, there are a number of long-term consequences of engaging in these behaviors. I've already talked about how focusing on the physical sensations can actually increase the intensity of the physical sensation. Checking behaviors such as poking and prodding the side of my neck to see if the pain or tenderness is spreading, that may lead to further inflammation and further tenderness. And it's the actual checking behavior that's causing the more pain and tenderness. Seeking reassurance or certainty from my doctor or seeking information on the internet, all that ends up doing is creating even more uncertainty about what's actually going on, and I never get the reassurance that there is nothing seriously wrong here. In fact, it might lead me to discover all sorts of new and awful potential causes of the pain or tenderness in my throat. Even though these might be extremely rare conditions, I'm now aware that I might have this super rare but extremely awful health condition. By avoiding situations, it limits my opportunities to challenge my perceived threat in a situation. If I'm concerned that my immune system is lower because of what's going on in my throat, I avoid all of the places where I could potentially get sick, and it never gives me an opportunity to actually see if I would get sick in those places. Maybe not. Maybe there's nothing that I should be fearing about being in those places. This avoidance also tends to make my world much smaller and leads to functional interference and limitations in my life. So what ends up happening is my worry about my health and what's going on in my throat continues and probably increases, which then increases my anxiety, which in turn brings on new physical sensations of anxiety, which leads me to question what's going on now. It's just started in my throat, but now I'm noticing pain and soreness in my shoulders and in my neck. Is it spreading? This leads to an increased desire to focus on the symptoms, to check and seek reassurance about what's happening now. Why is it spreading? And to avoid and use safety behaviors to try and make me less anxious. And it's just a vicious cycle that keeps going and going and going. So as you look at this model of health anxiety, you might feel a little overwhelmed to see how some of the things that you do to try and control or reduce your worry or anxiety about health is actually making your worry and anxiety worse. But the key is, by understanding this process, by understanding what causes and maintains the health anxiety, there are things that you can do to interrupt this process and break the vicious cycles.
How we pay too much attention to physical health symptoms, and how by focusing too much on those symptoms, it actually makes the symptoms feel more intense, kind of like a sneaky trap. The tricky part is that when those symptoms feel worse, it's natural to start to worry even more about them. And this triggers even more anxiety, and it becomes this self-fulfilling cycle that keeps dragging the person down into worse and worse health anxiety. The more anxious we become, the more we feel the need to focus on our health symptoms because we're genuinely concerned about them, which just makes us feel even more anxious, and it becomes this frustrating spiral. So in today's video, we're going to be talking about some strategies that you can use to help break you out of this health anxiety spiral and gain some control over your health worries. Now, people who struggle with health anxiety often find themselves meticulously examining their bodies for any signs of illness, which inevitably leads to worry about these bodily sensations. Now, being aware of bodily changes and potential health issues is normal. Everybody does it to some extent. However, if you're spending excessive time fixating on your physical symptoms or struggling to break free from the thoughts about your health or potential illness, it can be helpful to direct your attention away from those symptoms. But before we get too much into that, I want you to think about what you tend to focus on when you're feeling anxious about your health. I often encourage my clients to make a list of the particular sensations or areas of their body that tend to consume their attention during these health anxiety episodes. And once you have this list of sensations or health worries, this becomes the list of symptoms or health thoughts that we want to redirect our attention away from. But why is redirecting attention so important? Why is it so critical? Well, as I mentioned earlier, fixating on physical symptoms can intensify their impact and fuel high levels of worry and anxiety. Additionally, when our attention is fixated on these physical symptoms, it prevents us from engaging in everyday activities and fulfilling other important tasks. Have you ever found it challenging to concentrate on doing your household chores, a work project, or simply being present with your loved ones because your mind is constantly wandering back to a specific area of your body or a particular health concern that you're focused on? This symptom-focused attention in health anxiety makes it really difficult for us to focus on any other aspects of life. So by learning to retain your attention is a critical initial step in managing and addressing health anxiety. Not only does it reduce the amount of focus on the physical sensations, but it also frees up your attention, allowing you to more fully engage in other activities and experiences that life has to offer. So, how do we do this? How can we shift our focus away from worrying about physical symptoms and bring our attention back to the present moment? One way to approach it is by considering your attention kind of like a muscle. And just like any muscle, if we don't exercise our attention regularly, it becomes weaker and less effective. So the key is to strengthen our attention and our ability to focus by giving it a regular workout. And one way of doing this is to consciously sustain your attention during everyday tasks. You see, when we're engaging in mundane day-to-day activities like washing dishes, folding laundry, or driving to pick up the kids from soccer practice, it's natural for our minds to often wander off. We start thinking about other things like work, what the weather is going to be like tomorrow, the argument I had with my wife, all sorts of other things, we rarely take the time to fully focus on the experience of our day-to-day tasks, like washing the dishes, the activity of folding laundry, or the actual route we take to the soccer field. It's during these types of activities that our minds tend to drift. We lose touch with the present moment, and we become disconnected from what we're actually doing and what's actually going on around us. But the thing is, these everyday tasks present a wonderful opportunity to practice strengthening our attention. And the idea is to gradually train yourself to sustain focus on these ordinary activities for longer and longer periods, giving your attention a solid workout. So, what I encourage my clients to do is to think about those everyday mundane tasks, those household chores that you frequently engage in, where your mind tends to wander. It could be anything from doing the dishes, taking a shower, ironing, gardening, cooking, eating, walking, driving, anything you do on a day-to-day basis. Spend some time and write down as many of these activities that you can think of. And once you have your list of potential activities to practice building your attention muscle, the next step is to select one and plan when and where you'll intentionally practice focusing your attention with that task. This intentional practice gradually strengthens your ability to keep your attention centered, which enhances your overall focus and presence in the here and now. So let's take the example of washing dishes to illustrate this practice. You make a conscious decision to focus your attention while washing the dishes. Initially, people are usually quite good at directing their attention to the task at hand. However, after a minute or two, their minds often start wandering off to something else. And the key practice here is to notice when your mind has wandered and to gently bring your attention back to washing the dishes. So in a way, the muscle that we're working on is more about the bringing the attention back rather than solely keeping it focused. And to assist with bringing your attention back to the present moment, I encourage you to engage your senses and to be mindful of the sensory experience you're having while washing the dishes or whatever the task is. So let's think about the 5 senses: the touch, sight, sound, smell, and taste. First, pay attention to the sense of touch. What does it actually feel like to wash the dishes? Take note of the texture and the temperature of the water and the sensation of the soap in your hands. Notice which parts of your body are in contact with the dishwashing process. Next, consider the sense of sight. What catches your eye as you're washing the dishes? Observe the interplay of light and shadows, contours and colors that unfold before you while you're washing your spaghetti meal off the dishes. Moving on to sound, listen closely to the different sounds associated with washing dishes. Pay attention to the sound of water pouring into the sink and the sound of the sponge scrubbing away the food particles. Take a moment to explore the sense of smell. Notice any distinct smells that arise. Do the smells change as the dishwater becomes dirtier? What does the dish soap smell like? See if you can detect multiple scents or changing scents as you do it. And lastly, consider taste. Now, you may not necessarily taste anything if there's nothing in your mouth, but perhaps you're chewing gum while you're doing the dishes. What do you know? What do you notice about the act of chewing gum? So you see, by bringing your attention to these sensory aspects, you're anchoring yourself in the present moment and you're cultivating a greater sense of the task at hand, which is washing the dishes. It's through this deliberate practice of engaging your senses that you strengthen your ability to redirect your attention back to the present, ultimately enhancing your overall focus and mindfulness. Now, the nice thing about this type of attention practice is that you can do it almost any time because it typically involves things that we do every day anyway. So I encourage people to practice attention on these mundane tasks at least 2 or 3 times a day. You're not doing anything extra by doing these exercises. All you're really doing is paying attention to stuff that you do anyway. So it's not like it's going to take up any more time in your day. Now, you might be wondering, okay, this makes sense. I can use this approach to maintain my focus on mundane tasks such as folding laundry or mowing the lawn or doing dishes. But how does this help with my health anxiety? Well, the idea is when you notice yourself getting preoccupied with a physical sensation or a worry about a particular physical symptom, what's happening with your attention in that situation? Well, your attention is focused on the physical symptom or the physical sensation and your worry and negative interpretation of what that physical sensation actually means. So when you catch yourself focusing your attention on these physical sensations, the idea is to work on redirecting your attention to something else, bringing your attention back in the here and now. So for example, if I notice that while I'm cooking dinner, I notice some numbness in my fingers and start to worry about what does that mean? If I've practiced this mundane task focusing, what I can do is pull my attention away from the worry about the numbness in my fingers and put my attention more fully into what I'm doing while I'm cooking dinner. It interrupts that negative spiral that happens in health anxiety, where I focus on the sensation, I notice it more intensely, it makes me more anxious, so I have to focus on it more. By removing the focus on the physical sensation, I'm interrupting this cycle and not getting so anxious or so worked up by it in that moment.
One of the big barriers that can often get in the way of this focus of attention training relates to lies that health anxiety will tell you about whether you should be focusing and paying attention to the feared physical sensations in the first place. In other words, if I think that paying attention to my physical sensations and the physical symptoms is actually helping me, then I'm more likely to do it. If paying attention to the physical symptoms is keeping me safe, then it would be irresponsible for me to not focus on those physical symptoms. And that's exactly what health anxiety wants you to do. And it will lie to you to get you to keep focusing on those physical sensations. So, with that background, here are 6 lies that health anxiety will get you to believe about the importance of paying attention to those feared physical sensations. So the first belief, the first lie, is that the act of focusing on my health symptoms allows me to determine their level of severity and potential danger. By paying attention to my health symptoms, I'm assessing how dangerous they are. It allows me to be aware of what's going on in my body and to be aware of whether or not things are changing and potentially getting worse. Belief number 2, focusing on my body ensures that I'm going to detect problems earlier on. If I'm constantly checking my skin for signs of moles or bumps or changes, then I'm more likely to notice problems earlier on. And if I can detect the problem earlier on, I have a greater chance of potential treatments working, and that will help me survive. Belief 3, by worrying about my health, I'm preparing myself for any possible outcome. In other words, focusing on the possibility of health problems helps me to prepare, and I get myself ready in case I ever do experience a significant health problem. It's kind of like the old Boy Scouts motto, always be prepared. In this case, by worrying about my health and focusing my attention on my health and physical symptoms, I'm preparing myself for anything that might come. Belief 4, if I don't pay close attention to physical symptoms, I'm tempting fate. It's almost like I'm viewing myself as extremely fragile or at risk. And so if I'm not paying close attention to what's going on in my body, it's almost like I'm rolling the dice, and it's only a matter of time before something bad happens. Another way of thinking about this is it's almost like I shouldn't get too cocky or overconfident about my health. Otherwise, the universe may smack me with a serious disease because I wasn't paying enough attention. Belief number 5, by worrying and focusing on the symptoms, it helps ward off the illness and disease. Now, this one has a little bit of a superstitious flavor to it. With this belief, the act of worrying, the act of attending to the physical sensations in and of themselves prevents bad things from happening. As long as I'm focusing on the symptoms, as long as I'm worrying about my health, nothing bad is going to happen to me. And finally, belief 6, my health worries will help me solve health problems. The idea is that because I'm worrying so much about my health, because I'm thinking about it so much, it allows me to come up with solutions if I ever do experience health problems. I'm not caught off guard because it's almost like I planned ahead for the health problems. So I'm ready to deal with them when they arrive. Now, do you hold any of those beliefs, even to a small degree? Do you see any positive benefit from worrying about your health or focusing on feared physical sensations? Because if you do, these beliefs are going to get you to continue worrying about your health and to continue focusing on those physical sensations, which just causes you to feel even more anxious. If it's true that health worries and focusing your attention on physical symptoms actually does all of these things, if it helps you solve health problems, if it helps you prevent illness and disease, if it prepares you for possible outcomes, if it helps you detect problems earlier on, and if it prevents you from getting too overconfident about your health, if your health worries did all of these things, it makes sense to continue worrying about your health and to continue focusing on your physical symptoms. And so it becomes really important that if you hold any of these positive beliefs about focusing on your physical symptoms or your health worries, that you need to challenge these beliefs first. Because these beliefs are telling you that your health worries and your symptom focus is helpful and protective, even if it isn't. So, how can you challenge? How can you evaluate and dissect whether or not these health beliefs are actually true? To do this, I get my clients to ask themselves a series of questions. And the first question is, what exactly is the positive belief that I hold about my health worries or the potential benefits of maintaining my focus on my physical symptoms? For example, I might hold the belief that focusing on my physical symptoms, it helps me determine how severe the symptoms are and how much danger I'm actually in. That's the positive belief that I need to challenge. So once I've identified that, the next question is to ask, what is the goal of focusing my attention on these health symptoms? Is focusing my attention really helping me determine how severe the symptoms are and how much danger I'm actually in? How exactly does it protect me? If I was diagnosed with a health problem tomorrow, did focusing on the symptoms or worrying about my health actually prepare me and protect me in any way? Now, once I've thought about that, the next set of questions relate to what are the negative consequences of focusing my attention on these health symptoms and worries? Essentially, what are the costs associated with this focusing and worry behavior? Does it increase the intensity of the physical sensations that I'm worrying about? Does it cause me to feel more anxious? Am I so preoccupied with one physical symptom that I might be missing out on others that might be more dangerous? How do I decide what I need to focus on? If your best friend was in the same situation that you're in and they were worrying about their health and focusing their attention on a particular physical symptom, would you encourage them to continue doing that? What would you say to your friend in that situation? Why wouldn't you encourage them to continue focusing on the sensations? And so, once you've gone through some of those questions and chipped away at the validity of these beliefs, what you want to ask yourself is, what do I take away from this? What are my conclusions about how beneficial or positive it is for me to continue focusing my attention on these physical sensations? Or what is the benefit of continuing to worry so much about them? And if you do this, what you'll probably find is that focusing so much attention on these physical symptoms comes with a lot more negatives than positives. And once you come to that conclusion, it makes it a lot easier to then work on some of those attention focusing skills that I talked about in the previous video. Now, it's pretty normal for people to have worries about their health, but the more we dwell on these worries, the more anxiety symptoms get triggered. These symptoms can range from increased heart rate to muscle tension, chest pain, lightheadedness, numbness and tingling, all sorts of common manifestations of anxiety that also mimic symptoms of other health conditions. So the more we allow our attention to be fixated on these bodily sensations, the more anxiety we're going to experience. Now, one of the things that can happen in health anxiety is that people attempt to manage their worries by distracting themselves or suppressing the thoughts about health. In other words, if I'm concerned about my health, I might consciously make an effort to not think about it or to avoid or suppress thoughts related to health worries. And while this approach may seem logical, there's a catch. And to explain this problem, I want you to imagine a little experiment. Imagine that I asked you for 1 minute to think about anything that you wanted to think about. Maybe you want to imagine yourself on a beautiful, serene beach, enjoying the sunshine, whatever you want to think about. But for that 1 minute that you're thinking about whatever you want to think about, I want you to try really, really hard to not think about a pink elephant. So imagine yourself on that beach, but no matter what you do, make sure that you're not thinking about a pink elephant while you're on the beach. And when I do this experiment with my clients, what ends up happening is that in that 1 minute, all they can think about is a pink elephant. No matter how hard they try not to think about a pink elephant, the thought of a pink elephant keeps popping into their mind. We call this the paradox of thought suppression. The more you try not to think about something, the more you end up thinking about it. Now, relating this to health anxiety worries, if one of the ways that I'm trying to manage my worries about my health is by trying to not think about those health worries or suppressing those health worries when they come up, what that means is that I'm just going to keep having these thoughts and health worries come up again and again and again because of the paradox of thought suppression. So I'm trying hard not to think about it, and it's the trying hard not to think about it that's causing me to keep thinking about it. So at this point, you might be a little confused, because if focusing on my worries creates more worries and more physical symptoms to worry about, and trying not to focus on my worry may actually increase the amount that I'm worrying, then what exactly am I supposed to do? Well, the third option that we have is something called worry postponement. And this is how worry postponement works. As soon as you notice that initial worrisome thought creeping in, so for example, I notice that I have chest pain and I'm worrying that it might be a sign of a heart attack or heart disease. Once I notice myself thinking that way, The idea is to make a conscious decision not to chase that line of thought any further at that moment. So while I acknowledge the presence of these worry thoughts, I don't allow those worry thoughts to consume my attention. But you might be asking, what exactly does it mean to not chase those worrisome thoughts any further? Well, it means that you resist the urge to focus on the symptoms or the sensations you're anxious about. You refrain from anticipating the absolute worst case scenarios and replaying them in your head repeatedly. So for example, instead of getting caught up in thoughts like, this could be cancer, I think the pain is getting worse, what will happen to me and my family if it is, I should see my doctor, instead, I consciously choose to let go of those worries for the time being. So I'm postponing my worry about my health until a more appropriate time to worry about my health. The idea is to use those attention skills that we've talked about before to bring your attention and focus back to the present moment. What's happening right now in the here and now. You can redirect your thoughts to the task at hand or to the situation that you're currently engaged in, just focusing on what's happening right now. And so by practicing this technique of worry postponement, you're gaining some control over your attention and you prevent the worries from overpowering your thoughts. It allows you to think about your health concerns with a clear and rational mindset at the time of your choosing, rather than getting tangled up in a web of anxious thoughts and hypothetical worst-case scenario. You're acknowledging the worry, but consciously deciding to postpone it and redirect your attention to what you were doing before the worry started. So that's the idea. That's the rationale of how worry postponement works. So how exactly do you do it? Well, there are 3 steps with worry postponement. And step 1 is to set up a worry time, a designated time and space where you're going to give your worries and your health-focused thoughts all of your attention. So you need to choose a specific time, place, and duration for your worry time. Maybe you decide to do it at 12:30 p.m. during your lunch break, and you'll allocate 15 minutes or even up to 30 minutes if needed for your health worry time. You want to establish consistency, so try to stick to the same worry time every day. This way, it's almost like you're training your mind to know when it's the designated time to think about those health worries. And that's why it's important to pick a time and place that you'll be able to do this consistently. Now, it's important that you avoid scheduling your worry time right before bedtime. The reason for this is because when we dwell on worries and symptoms right before we go to sleep, it can make it much more difficult for us to relax and unwind. So what you want to do is to give yourself some buffer time between your worry time and when you start your bedtime routine. Now, the next step is actually working at postponing the worry. As soon as you start to notice yourself worrying or fixating on a particular physical symptom, what I'd encourage you to do is to pull out your phone and take a brief note of what it is that you're worrying about. The key is to keep it brief, using just a couple of words to capture the essence of each health worry that you're having. For example, I might write down something like, noticed I was starting to have a headache, thought it could be a brain tumor. Once you've written it down in your phone, the crucial next step is to make a conscious decision to set aside those thoughts and to save them for your designated worry time. Remind yourself that you'll have time to think about these worries and physical sensations later on. And by doing so, you reinforce the idea that you have control over your thoughts and you're actively choosing where and when to engage with your health concerns. By postponing the worry, what it does is it gives you the freedom to refocus your attention back to what you were doing before the worry thoughts kicked in. And then the third step is when you actually get to your worry time. This is your chance to pull out your phone and to think about those worries that you jotted down over the course of the day. Now, one thing that's important at this point is remember, you have the freedom to choose which worries to focus on during this time. If some of the worries that you wrote down no longer bother you or don't seem to be that big of a deal anymore, you can let them go. You don't have to force yourself to worry about every single item on the list if it doesn't serve a purpose anymore. But for all the worries that still require your attention, the idea is to go ahead and dive into them. You can explore the worries, analyze them, and let them have their moment. You're giving yourself permission to engage with these health worries in a controlled way. But you can only focus on these worries for a specific amount of time that you've set for your worry time. And it's really important to stick to the plan. If you allocated 20 minutes, set a timer for 20 minutes. And once that timer goes off, your worry time is over. Now, if you run out of time and there are still worries that require your attention, write them down in your phone and remind yourself that you have another worry time scheduled for tomorrow. At that worry time, you can think about the remaining items that you didn't get to in today's worry time. By giving yourself this assurance, it allows you to let go of those unfinished worries and provides a sense of structure and control over your thinking. So, I'd encourage you to try this out for a week or two and see what happens with your health worries. Do you notice that when you actually get into the worry time, some of the health worries that you had during the day no longer seem that important? Do you find that when you think through your worries during the worry time, and do you run out of things to think about before the worry time is over? Do you find that some of the worries that you had to postpone because you ran out of worry time didn't seem to be that big of a deal the next day during your scheduled worry time? Lots of things to think about, lots of things to pay attention to during the worry time. And the thing is, this is a skill, and like any skill, it requires practice and patience. It's not going to feel natural, and you may not find that it works perfectly the first few times that you do it. But the more you do it, the more you practice this worry postponement, what you'll find is that it does actually give you a greater sense of control over what you're worrying about and when you're worrying about it.
But in health anxiety, the way people interpret various body sensations and signs tends to be more negative and catastrophic. And that's one of the big factors that perpetuates and fuels health anxiety. So in today's video, we're going to be taking a look at some of the common health anxiety thoughts and how the way a person thinks about their health can play a massive role in terms of how anxious they are. It's very common in health anxiety that people will perceive that there's a greater danger or threat to their health than is actually the case. Now, that's not to say that people with health anxiety are imagining their physical symptoms or signs. So, for example, if a person with health anxiety notices that they've been having stomach pain or that there's a mole on their arm that they hadn't noticed before, it's not that the person is delusional and is imagining things that aren't there. They actually do have stomach pain. There is a mole on their arm. The physical signs and physical sensations are real. They're genuinely happening. So the problem with health anxiety isn't about whether or not the symptoms are present. It's more about how the symptoms are understood and interpreted. And typically what happens with health anxiety is that people interpret their physical symptoms in catastrophic ways that often result in intense anxiety feelings and physical symptoms stemming from the anxiety itself. Now, there are 4 broad catastrophic ways that people with health anxiety will think. And the first is that they tend to overestimate the likelihood that they have or will develop a serious health problem. This tends to be the case a lot of the time when people overestimate the likelihood that they're experiencing a very rare but awful disease. The second catastrophic way that people will think is that they overestimate how bad things will be. If this mole is cancerous, it means that the cancer has likely spread throughout my body and I'm going to die because of it. The person may not consider the possibility that the cancer could be localized and it can be effectively removed and treated. The third catastrophic way that people will think about their health is that they ignore or put less weight on other potential and often less catastrophic explanations for the symptoms that they're experiencing or the information that their doctor might tell them for reassurance. Sure, my doctor has told me that it's highly unlikely that this is stomach cancer, but he hasn't done all of the scans and all of the tests, so how can my doctor know for sure? And finally, people with health anxiety often underestimate their ability to cope with or manage potential health problems. If this is arthritis, what this means is that I'm not going to be able to be as mobile, and I'm going to have to give up all of the sports and activities that I love doing. That will be completely awful. So you can imagine if you tend to think about your health and health symptoms in these catastrophic ways, overestimating the likelihood that bad things are going to happen, underestimating your ability to cope or deal with the physical symptoms, then any physical symptoms or signs are going to be extremely anxiety-provoking. Not because of the sign or the symptom itself, but because of the way that you're thinking about the meaning of the signs and the symptoms. It's the interpretation that's key in driving the anxiety. So I want you to imagine the following scenarios and the catastrophic, overly negative interpretations that someone with health anxiety may have in these scenarios and situations. I've been feeling tired and run down. This is a sign that I have leukemia. I've been going to the bathroom more often. I must have diabetes. My mom had cancer. It's only a matter of time before I get cancer. I have some pain in my side. What if it's ovarian or stomach cancer? I have a new mole that I notice. This is melanoma, and it's likely spread throughout my body. I've had 2 headaches in the past week. It's a brain tumor or an aneurysm. I forgot where I put my keys. This is an early sign that I have dementia. My stomach's been a little upset lately. This is likely colon cancer. So you see, these are all generally common physical sensations and signs that people will often experience. But for people without health anxiety, they don't tend to think too much about the symptoms, and the symptoms pass away on their own. But for someone with health anxiety, they engage in this catastrophic thinking, which maintains the focus on their physical sensations and actually contributes to a worsening of their anxiety about the sensations. Now, importantly, there are a couple of ways that this catastrophic thinking actually makes your anxiety worse. First, the catastrophic nature of the thoughts themselves. So, for example, if anyone thought that they had melanoma and were going to die, regardless of whether or not they had health anxiety, most people would get quite anxious and upset about that. But the second way that this catastrophic thinking actually perpetuates the anxiety is by exacerbating physical sensations themselves and giving a person with health anxiety even more sensations to catastrophically misinterpret and be anxious about. So the way it works, I have these worries about my health. I have these negative interpretations about the particular signs or symptoms that other people might consider to be benign or not that big of a deal. But because I interpret these signs and symptoms in catastrophic ways, this leads to increased anxiety and associated physical sensations of anxiety. Things like increased heart rate, muscle tension, aches and pains, dizziness, lightheadedness, stomach distress, those types of things. So now I'm having these physical sensations associated with my anxiety, which leads to more worry about the original issue, and now these other physical sensations that I'm experiencing. This then leads me to feeling even more anxious and leading to even more physical sensations of anxiety, which then contributes to even more worry and catastrophic misinterpretations of the sensations that now seem to be getting worse or more intense. So you can see the spiral that could happen in health anxiety based solely on the way a person is thinking about their physical sensations and signs. Now, the important part is that something can be done about this vicious cycle, and it doesn't involve trying to eliminate or reduce the physical sensations and signs. That we don't have any control over. People will have aches and pains that they don't know the cause of, and that's a natural part of life. So while we can't eliminate any potential health anxiety triggers, we can change the way we interpret and think about the signs and symptoms. And if you can think in less catastrophic ways about these normal physical signs and symptoms that we all experience, then you're less likely to feel anxious about them, and you're less likely to enter into that health anxiety vicious spiral. So the only way to determine whether our thoughts are accurate, partially accurate, or completely inaccurate is to recognize the thoughts, examine them, and evaluate how true they actually are. One way of thinking about this is to imagine that you're in a courtroom and that you're putting some of your thoughts on trial. So in order to evaluate whether or not your thoughts are true, you need to collect evidence and make arguments for and against the truthfulness of the thought. And based on the evidence that you collect and that you present, you can then make a judgment on whether or not this thought is accurate and true. Now, this can be something that can be quite challenging if you're trying to do it in your head, as it's hard enough to keep track of one set of thoughts and so much more difficult to keep track of multiple different sets of thoughts, presenting different evidence and proof to support or discount the truthfulness of a thought. You can imagine how hard that would be to try and keep track of in your mind and how messy and confusing it could get. So the way around this is to work through a thought diary or a thought record, which allows you to write down and track your evaluation of these health-related thoughts. Essentially what this thought record does is it allows you to get the various thoughts out of your head and organize them in a clear, succinct way that allows you to analyze the thoughts on a piece of paper. So the first thing to do is to recognize when you're experiencing an episode of health anxiety, when you have started worrying intensely about a particular aspect of your health, and to think about the context that this health anxiety worry is taking place in. So essentially, you're asking yourself, what was the trigger for this current health anxiety episode? So for example, I'm watching a news story on TV and there's a reference to prevalence rates of leukemia. And I notice that I've been feeling run down and tired over the last few weeks. Once you've identified the trigger and the context for this health anxiety episode, the next thing to ask yourself is, what is it that I'm worrying about? What are my health worries in this moment? You can also ask yourself, what is it that I'm predicting is going to happen in this situation? And what are the conclusions that my thoughts are going towards? Well, in the example, I might start worrying that I'm not just feeling run down and tired because I've been working a lot, but that this is an underlying sign of leukemia and that this is the start of my decline into death. I worry that I've been feeling tired and run down for a while, and even though I've talked to my doctor about it in the past, nothing has come up in any of the blood work that my doctor's done. But maybe my doctor hasn't ordered the right tests to identify whether or not I have leukemia. So the next step to ask yourself, once you've identified the thoughts and the thoughts that you're having in the situation, what you want to ask yourself is, how are you feeling in this situation? What are some of the emotions that are coming up? Are you scared? Are you angry? Are you sad or are you hopeless? What are some of the physical sensations that you're noticing? Are your muscles tense? Are you feeling lightheaded or even more tired or run down? In the example that we're talking about, I might find myself feeling really anxious, noticing that my heart's beating faster and feeling tension throughout my body. So now you have the situation or the trigger, you have some of the health anxiety thoughts that you're thinking about in this situation, and you've now recognized the physical and emotional impact that these thoughts in this situation are having on you. Now we have an opportunity to actually look at and examine and challenge how realistic, true, or accurate these thoughts actually are. So some questions to ask yourself is, what exactly is the evidence that supports my thoughts in this situation? What is the evidence that might demonstrate that my thoughts are not entirely true? Are there any other possible explanations for the physical sensations I'm experiencing? What is the worst case scenario here? And would I be able to cope even if that worst case scenario were to happen? What are the most realistic or likely explanations for what I'm currently experiencing? What can be done to cope with this situation or this physical sensation that I'm experiencing? So, in the example, the evidence that supports my thoughts in the situation are that I've been feeling tired and I know that fatigue is a symptom of leukemia because I've looked it up on the internet. Well, what about the evidence that doesn't support the thought? Well, I've had previous tests by my doctor that haven't discovered anything suspicious. I don't have any family history of cancer. I've been very busy at work over the past few months, and maybe that's what could be wearing me down. Asking myself, are there any other possible explanations for the physical sensations? Well, as I've just noted, I've been really busy at work, and that has been wearing me down. I also haven't been eating particularly healthy recently. I've been under a lot of stress, which could also be contributing to how tired I feel. Well, what is the worst case scenario, and would I be able to cope even if it were to happen? Well, in this situation, the worst case scenario is that I would have leukemia and I'd have to have treatment, which will likely involve chemotherapy and a bone marrow transplant. It's probably going to be very difficult to experience. It's going to be a very difficult experience to go through, but treatment options are available, and I know that I'll have the support from my family and friends to help me get through the best I can. What is the most realistic or likely explanation for what I'm currently experiencing? Well, the most realistic explanation, based on all of the information we have available, is that I'm probably feeling tired because I'm working a lot, I'm running myself down, and I'm feeling pretty stressed out, which all seem like more likely explanations for my fatigue rather than leukemia. So, what can I do to cope with this situation and manage the fatigue? Well, I can be looking at ways of improving my diet, getting to bed at a more reasonable hour, maybe looking at ways of getting more exercise, like going for nightly walks with my wife. Maybe I can also speak with my boss about getting some help for some of the projects that I'm working on and that are wearing me out. And so once I've gone through all of those steps, I've recognized the trigger, I've recognized my thoughts, I've recognized how I'm feeling, I've looked at the evidence for and against my health anxiety worries, I've thought about other possible explanations and other ways of coping. By the time I've gone through all of that, I've taken this worry that might have been leukemia, and I've dissected it, examined it, and found that apart from me feeling tired recently, there isn't a lot to support that I'm going to die imminently from leukemia. And by thinking about it in this different way, my perception and my perspective is much different, and I'm much less likely to be anxious or fearful of the situation or fearful of the sensation of fatigue that I've been experiencing. So the way to use this information is that when you start to notice yourself starting to feel really anxious about your health, pull out a sheet of paper and work through these questions, writing down the answers, and try to come up with a realistic interpretation or a realistic evaluation of what's actually going on and how serious or dangerous it actually is. Now, it's important to point out that this is something that takes some practice. This is something we call cognitive therapy, and it's not something you pick up right away, in large part because we're not used to thinking about our thinking. So while it can feel a little unnatural at first, the more you do it, the more effective you become at recognizing, evaluating, and challenging these health anxiety worries. And the more you do this, the more it becomes second nature, and you can start to challenge those health anxiety worries in your head. Additionally, as you start to do more and more of these thought records, what you'll notice is that you may have the same unhelpful and distressing health-related worries come up again and again and again. And once you start to notice this, you can start to keep track of more realistic thoughts that you can think to challenge and counter those unrealistic and unhelpful health anxiety thoughts when they come up. This is almost like a bit of mental shorthand, and it allows you to come up with your conclusion automatically without having to go through the thought record process, because you've done a thought record to challenge this health thought and this health worry over and over and over and over again. So what often happens is that people will start to engage in checking or reassurance-seeking behaviors as a way of trying to reduce their health worries. But the problem is, these types of checking or reassurance-seeking behaviors actually have the opposite effect and can cause even more anxiety. So in today's video, we're going to be talking about how reassurance-seeking and checking behavior actually plays a role in causing and maintaining health worries, as a way of beginning to understand why it's so important to eliminate or limit these types of behaviors. Now, it's important to point out that everybody engages in checking and reassurance seeking from time to time when it comes to their own health. So the act of checking or reassurance seeking in and of itself isn't a problem. And it's natural to want to check or to want to get some reassurance that some of our physical sensations are benign and not dangerous, as a way of just easing our minds. And when we check or seek reassurance and find out that what we're concerned about is nothing to be concerned about, then we get a sense of relief and we feel better, at least in the short term. But the thing is, we can never get 100% certainty about our health. Just like lots of areas in our lives, we have to accept a certain level of uncertainty around our health, because doctors can't test for everything that could possibly go wrong in our bodies. And so no doctor can give you 100% certainty that you're 100% healthy in any given moment. So the danger with checking or reassurance seeking is that we can fall into a vicious cycle where the checking and reassurance seeking gives us a little bit of relief for a short moment in time, but those behaviors actually fuel anxiety in the long term. So think about how this works. Imagine that I have some worry about my health, and so I engage in checking and reassurance seeking from my doctor. My doctor does a few tests, and the tests come back negative, so my doctor tells me I have nothing to be concerned about. So I feel better in the short term. But maybe a couple of weeks later, I start to notice that those symptoms that I was concerned about are still there, and my doctor couldn't completely rule out that there wasn't something wrong, just that the tests that my doctor did came back negative. So now I start to worry about maybe my doctor didn't do the right tests, or that the tests my doctor didn't pick up on an underlying problem. And so now I'm worrying more, and the cycle continues. I want you to imagine that checking or reassurance seeking is kind of like wanting to fill a bucket with water. And so you're pouring water into this bucket, but the bucket has a big hole in the bottom of it. So the water is draining, and you're constantly having to pour more and more water into the bucket, but the bucket never gets full. This is what happens with reassurance seeking and checking. We're constantly pouring more reassurance and more checking into this bucket with a hole in it, and so we never get the relief and the certainty that we want from these reassurance and checking behaviors. The other thing to think about is the message that you might be giving yourself or telling yourself by engaging in constant checking and reassurance seeking. Our minds and our brain will take cues and direction from our behavior. And think about what my behavior with these types of checking and reassurance seeking activities is indirectly telling me. So for example, imagine that I'm concerned about having a cancerous mole on my arm. I've repeatedly gone back to my doctor, who's examined the mole, sent me to a dermatologist. I've had tests and samples taken of it, and everything's come back clean, but I'm still seeking more and more reassurance or certainty that the mole isn't cancerous. Now, if the mole wasn't cancerous, why would I be engaging in all of these doctor's appointments and diagnostic tests? Well, if the mole wasn't cancerous, it would be nonsensical to engage in all of these health checking behaviors. So by engaging in these checking and reassurance seeking behaviors, the underlying message I'm repeating to myself is that this is cancer. They just haven't confirmed it yet. And this is what causes me to feel even more anxious about the mole. So I want you to imagine and think about all of the various ways that we can engage in checking or reassurance seeking around our health or physical status. Things like, poking or pinching or prodding various areas on our skin or other areas of our body. Looking at the mirror and paying attention to any indication of new moles or lumps or bumps or discoloration. Monitoring body processes like repeatedly checking blood pressure, monitoring heart rate using a smartwatch, frequently weighing ourselves. These can also include measuring parts of my body using a tape measure to see if my legs are more swollen than they were last week. I could be paying attention to and examining bodily secretions, like actually examine or looking at my saliva or the color of my urine, or if there's any signs of blood or infection in my poop. I might check in with family members or friends or my doctor about various physical sensations, checking to see how normal or how common it is to have the sensation. In an earlier video, I talked about researching symptoms on the internet or getting a copy of blood work and then going to the internet and trying to interpret the results as a way of getting reassurance that everything is normal. This can also take the form of going to online forums and discussing the symptoms that you're experiencing and asking other people for their opinions or thoughts about what you're experiencing. Checking and reassurance seeking can take the form of seeking out medical tests or second opinions or asking your doctor for a referral to a specialist, even if they don't think it's necessary. So there are lots of different ways that we can engage in checking or seeking reassurance around our health or various symptoms. So the first step is to recognize how often you engage in these types of behaviors. One thing I encourage people to do is to carry around a little notepad with them and write down when they catch themselves engaging in reassurance seeking or checking behaviors. Write down specifically what they were doing and what was the context or the situation that they were doing it in. This could also include keeping track of medical appointments and asking friends or family to point out when you seek reassurance or check in with them about your health. One of the things that can happen is that once people start to pay attention to how much checking or reassurance seeking behavior they are actually engaging in, they may be surprised how often they're doing it and how automatic it can become. So just the process of recognizing these behaviors and shining a magnifying glass on them can be an important first step in recognizing their impact. Now, One of the things that makes this really difficult is that we're often told that it's good to pay attention to our physical sensations. It's good to do regular breast exams. TV commercials will tell us that if we're experiencing certain symptoms, check with our doctor. And I'm not saying that you should never engage in these types of behaviors, because these types of health promoting checking behavior can actually help us identify problems early on and protect us. But it's got to be within reason. And this is where a person has to ask themselves, when is the checking or reassurance seeking crossing over into problematic behavior? And one way to think about this is that our reassurance seeking and checking behaviors fall on a continuum. On one end of the continuum are people who never check, never monitor their health, never book doctor's appointments, never pay attention to any potential signs of health problems. And on the other end of the continuum are people who frequently and repeatedly check their bodies for signs or symptoms of danger. People who seek out information, make frequent doctor's appointments, regularly talk about health concerns with family and friends, and constantly check on the internet for information about health or particular symptoms. Neither of these extremes is a good thing, and neither of these actually promote physical or mental well-being. Ignoring your body, ignoring signs of potential danger or disease can lead to a person not recognizing early warning signs and ending up with more serious health problems that they could have addressed much earlier on if they had just been paying more attention. But hyper-focusing on health is just going to make you more aware of everything that can go wrong, which can exacerbate concerning symptoms and cause all sorts of other problems. So, for example, if I'm concerned about some soreness in my neck, I might start poking and prodding and squeezing the area around my throat to see if the pain's getting worse. But by frequently poking and prodding and squeezing this area around my throat, this can actually lead to increased feelings of pain or tenderness, which I then might interpret as some underlying condition getting worse. The frequent checking and reassurance seeking can lead to a person booking frequent medical appointments where they have to take time off work to go sit in their doctor's office. They may have to book imaging or diagnostic tests, which can take up lots of time and disrupt a person's schedule. Depending on where you live, these diagnostic tests or doctor's appointments may or may not be covered, and so this can result in significant financial burden for people. And if a person is constantly seeking reassurance or checking in with family or friends about their health and health concerns, this can lead to frustration, irritation, and conflict in those relationships because people just get tired of hearing about the latest health concern a person might have. And family and friends may then label them with unhelpful terms like hypochondriac, which just leaves a person feeling dismissed or invalidated. So the goal here isn't to fully eliminate any checking or reassurance-seeking behaviors, but rather to try to bring those behaviors into the realm of healthy, productive checking and reassurance-seeking. To try to get a person into that middle zone on the continuum rather than being on one end or the other, neither of which is helpful. So it's important to recognize and reduce the amount of checking and reassurance-seeking behavior that you might be engaging in if you're experiencing high levels of health anxiety. So what I want to talk about in today's video is how exactly does a person go about reducing the amount of health checking and reassurance-seeking that they're doing. And it's not simply a matter of telling yourself to just stop it, because that's a lot easier said than done. So I want to talk about 3 steps that a person can use to reduce or eliminate their health checking and reassurance-seeking behaviors. And the first step is to evaluate the actual benefits that the reassurance-seeking or checking behavior is actually giving you. So for example, if I have a mole on my arm that I'm concerned about, I might notice that I'm measuring it on a daily basis or poking it and prodding it to see if it's getting more painful. So once I recognize the checking behavior, I want to ask myself a few questions to figure out how helpful the behavior is. So I want to ask myself, what's the purpose of doing this? What's the benefit or the advantage of doing this behavior as frequently as I'm doing it? Are there any disadvantages or costs associated with doing this behavior as much as I'm doing it? Does this behavior actually help me accomplish what I want in this situation? How reasonable is it for me to continue doing this health checking behavior as frequently as I'm doing it? And once I have all of these potential advantages and disadvantages, I want to ask myself, do the benefits of engaging in this checking behavior outweigh the disadvantages or the costs of what I'm doing? By asking yourself these questions, what you're doing is taking a step away from the checking or reassurance-seeking behavior, and you're examining why you're actually doing it and the potential benefits of doing it. If you recognize that the disadvantages outweigh the advantages of this behavior, that's a pretty good sign that you need to change what you're doing, and this recognition can help motivate you to do something about it. Now, that doesn't necessarily mean that you have to completely eliminate the behavior. It doesn't mean that I completely ignore and stop paying attention to this mole on my arm. Rather, I may want to reduce how often I'm checking or postponing that behavior. I can still check the mole, but not necessarily checking the mole when I feel a pang of anxiety and I feel a sudden rush to look at it and compare what I'm seeing to pictures that I took of the mole last week. Rather, I might want to put off checking the mole for maybe a week and see if I still feel that same level of urge or need to check the mole. So in doing this, I can reduce how frequently I'm engaging in the checking behavior. Now, there are some reassurance-seeking and checking behaviors that may just be best eliminated because there's little chance that the potential benefits are ever going to outweigh the potential costs. The most common example that I talk about is going to online discussion sites about health conditions or diseases and seeking reassurance or asking other people on those sites about symptoms that you're experiencing. The quality of information that you're going to get in that scenario is likely pretty low. And so that may be something that you don't just want to reduce the frequency of how much you're doing it, but that may be something to completely eliminate. So once you've decided that the disadvantages outweigh the advantages of the checking and reassurance-seeking behavior, and you've determined that you either want to reduce the frequency of a behavior or to eliminate the behavior, step 2 focuses on making a goal and a plan for how you actually change your behavior. And I've talked a lot in previous videos about how to set goals in the context of depression, but the exact same approach works for reducing or eliminating these reassurance-seeking or checking behaviors in health anxiety. So when you're setting these goals, you want to make sure that the goal is specific and that you know exactly what it is that you're going to do. You want to make sure that the goal is defined in terms of your behavior. It's something that you're going to be doing, not how you're going to feel doing it. You want to make sure that the goal has a clear end line, that you'll know exactly what you need to do to know when you've accomplished the goal. And the goal has to be realistic in that you're 95% certain that you'll be able to accomplish the goal. So for example, imagine that I've been researching information on skin cancer on the internet, and my ultimate goal may be to postpone or reduce how much of that internet research that I'm doing. So I can set a goal of, for this week, whenever I feel an urge to look up something about skin cancer on the internet, I'm going to set a timer for an hour and not do any internet research until that hour has expired. I know exactly what I'm going to do. It's defined in terms of my behavior. I'll know whether or not I've done it, and I may be 95% certain that I can actually do it. Now, that last part can be a little bit tricky for people. It's common that when people start to try and reduce or eliminate these health checking or reassurance seeking behaviors, that people start to experience increased levels of anxiety in the short term. So it could potentially be too big of a step for me to set a timer for an hour. Maybe I can set the goal that for this week, I set a timer for 5 minutes. And after that 5 minutes, then I can engage in the internet research. And then maybe the next week, I set the timer for 10 minutes. And the week after that, the timer gets set for 20 minutes, and so on and so forth. In this way, I gradually increase the amount of time that I'm postponing my internet research and doing it in a way that I'm not spiking my anxiety and causing too big of a surge in anxiety that I'm not going to be able to complete the goal. And this brings up an important point, that when you start to reduce or eliminate these reassurance-seeking or checking behaviors, it's going to cause your health anxiety to increase at first. That's because these reassurance-seeking and checking behaviors can be helpful to reduce anxiety in the short term. If I check the size of my mole and it's no bigger than it was last week, I get some reassurance that it's not grown and I feel better. The problem is, in the long term, this reassurance-seeking and checking behavior perpetuates my anxiety. So by eliminating or reducing the reassurance-seeking or checking, what that's going to do is cause a temporary increase in anxiety in the short term. But as long as I continue to not engage in these reassurance-seeking and checking behaviors, the anxiety about my health will go down in the long run. So part of this is understanding and recognizing that there is going to be a temporary increase in the anxiety, but also learning that you can tolerate that anxiety without having to do anything to make it go away. So once you have your goal and your plan for what you're going to do, the third step is to actually implement the plan. So I start setting a timer every time I feel an urge to do some internet research about skin cancer, and I see what happens. It's at this point where you can really evaluate whether or not reducing or eliminating the checking or reassurance-seeking behavior is helpful. Ask yourself, by delaying or eliminating the checking or reassurance-seeking behavior, how did I feel? Did I notice that my anxiety was worse? Was it better? Was there no difference? Did I surprise myself with how capable I was at not engaging in the checking or reassurance-seeking behavior? Was the anxiety really as bad as I thought it would be? What are the conclusions that I can take away from changing these reassurance-seeking and checking behaviors? What most people find is that over time, as they engage in less and less of these checking and reassurance-seeking behaviors, their focus on potential health catastrophes goes down, and with it, they feel less anxious about their health more generally. And for someone with health anxiety, the thought of coming into contact with anything that could potentially threaten their health and safety can be terrifying. This fear leads to avoidance, where a person might avoid anything that might trigger their anxiety about illness or death. This is a continuation of our video series about health anxiety, and in today's video, we're going to be talking about how avoidance in health anxiety makes health anxiety worse, and how avoidance causes significant problems and difficulties in a person's life. So let's start by talking about what people with health anxiety tend to avoid. A person with health anxiety may avoid other people. Imagine having a friend or a relative who's sick. Even if their illness isn't contagious, just being around that person might trigger fears about catching something or being reminded of your own vulnerability. And as a result, a person with health anxiety might avoid seeing friends or relatives who might be sick. They might also avoid healthcare professionals, such as doctors or nurses, because they associate doctors and nurses with illness or being sick. Even the idea of seeing a doctor might bring up fear of being diagnosed with something serious, so it feels safer to just avoid these people altogether. A person with health anxiety can avoid certain places. Places can trigger thoughts of sickness, death, or germs. Hospitals are a very common example of places that people with health anxiety will avoid. For someone with health anxiety, just walking into a hospital or into a clinic can feel like walking into danger. Funeral homes are another place that people might avoid because they bring up the reminder of a person's mortality and inevitable death. People with health anxiety will avoid activities that can trigger health-related fears. Things like medical appointments, conversations about health, watching news stories related to health topics, those types of things. On top of these more obvious forms of avoidance, people with health anxiety often worry excessively about physical sensations in their body. And this hyper-awareness of what's going on in the body can lead to avoiding activities that may bring on physical sensations. Things like avoiding exercise, avoiding sex, avoiding eating certain foods or drinking coffee. Anything that might bring on physical sensations that a person with health anxiety might interpret as a sign of danger. Now, when complete avoidance isn't practical or possible, sometimes people with health anxiety can rely on something we call safety behaviors. And these are behaviors that people will do to protect themselves from potential threat, which allows them to do exposure to the feared situation, but almost with the feeling of a safety net. Now, while these behaviors might seem like a reasonable compromise, they actually serve to maintain the anxiety, just like avoidance does. For example, let's say someone with health anxiety is invited to visit a friend who has a non-infectious illness like diabetes. Now, instead of declining the invitation, the person may go, but they may engage in all sorts of safety precautions. They may take a course of preventative antibiotics, even though the friend's illness isn't infectious, and they do this just to feel more secure. Once they're at the friend's house, they may avoid touching anything or they may use hand sanitizer frequently. Now, although these types of safety behaviors are more subtle than full-blown avoidance, they serve a similar purpose. They prevent the person with health anxiety from fully engaging with their fears and testing out whether those fears are justified. So in our example, I might never learn that visiting a friend with diabetes isn't dangerous. Instead, I believe that it was the safety behaviors that I did that actually kept me safe, and without them, something really bad could have happened. So, while both avoidance and safety behaviors can provide some temporary relief from health anxiety, they come at a high cost. And the most significant problem is that these behaviors maintain and reinforce a person's health anxiety. By avoiding situations or relying on safety behaviors, I never allow myself to face my fears and discover whether those fears are legitimate. This avoidance prevents me from gathering the evidence that can help me disprove my catastrophic thoughts about health. And over time, my mind becomes stuck in a cycle of anxiety because the fears remain unchallenged and untested. In essence, I become stuck in a world where my worst fears seem like very real possibilities because I've never taken the steps to disprove them. And the more you rely on avoidance and safety behaviors, the more you become convinced that these strategies are necessary for your safety. And this can slowly chip away at a person's self-confidence. Each time you avoid a situation or you use a safety behavior, you reinforce the belief that you're not capable of handling it on your own. Over time, this belief becomes stronger and stronger, and you become increasingly dependent on these behaviors. And as this dependence on these safety behaviors grows, your world starts to shrink. You might find yourself avoiding more and more situations because the list of things that trigger you with health that trigger your health anxiety expands. What might begin as avoiding hospitals or doctors' offices extends to avoiding social gatherings where people might be talking about health. You might start to avoid exercise because it raises your heart rate, or you stop enjoying your favorite foods because they might cause discomfort. And this cycle leads to a very restricted and unsatisfying life. The activities and experiences that you once enjoyed become off limits because they trigger health anxiety. Your social life might suffer as you avoid friends or family who could remind you of health issues. Even everyday activities like shopping, eating out, or going to work might feel overwhelming, leading you to withdraw even further. So what starts out as short-term relief from anxiety by engaging in avoidance and safety behaviors ends up trapping you in your health anxiety. So the way out of this is to begin to challenge and eliminate avoidance and safety behaviors, which can ultimately demonstrate that what you're anxious about happening doesn't actually happen. And we do this through a process called graduated exposure. Sometimes people suggest that the best way to deal with these fears is to tackle them head on, kind of like diving into the deep end of a swimming pool. This approach is something called flooding, where you expose yourself to your biggest fears all at once. If I'm afraid of a spider, I'm going to hold a tarantula in my hand. Now, while this method might work for some people, it's not ideal and definitely doesn't work for everyone. If you jump into the deep end of the swimming pool without knowing how to swim, this can be incredibly dangerous and not a great recipe for success. If you're not prepared, flooding can make you feel like you're drowning in anxiety, which can then reinforce and worsen your fears, leaving you feeling even more anxious than before. And we call this sensitization. And this can make the health anxiety even stronger and harder to overcome in the future. So a much more effective and realistic approach is to take things step by step, kind of like climbing up a ladder. And this gradual process is something we call graded exposure or gradual exposure. Exposure that allows you to experience your fears in a controlled and gradual way. You see, what happens in health anxiety is that people often find themselves overestimating the likelihood that they have or will develop a serious health problem. For example, something like a minor headache gets misinterpreted as a sign of a brain tumor. A slight cough can be seen as early signs of a serious lung disease. These catastrophic thoughts are often accompanied by an underestimation of the person's ability to cope if these health problems were to actually happen. Now, when a person avoids situations that trigger these fears, they never give themselves the chance to see whether their fears are realistic. But by gradually exposing yourself to these fear situations, you start to gather evidence that allows you to evaluate and challenge these assumptions. For example, a person might avoid going to the doctor because they fear that the doctor is going to give them bad news. But by making a point to go to regular checkups, the person might actually discover that their health is better than they feared, or if there is an issue, it's entirely manageable. And over time, repeated exposure helps you develop a more realistic understanding of actual health risks and builds your confidence in your ability to handle issues related to health. And over time, a person begins to see that the likelihood of a serious health problem is often a lot lower than they ever imagined. And even if a health issue does arise, they can cope with it. So in terms of targets of exposure therapy and health anxiety, one of the keys is to get used to the physical sensations that trigger the health anxiety itself. One of the key challenges of health anxiety is an intense focus on body sensations. Minor changes in your body, like increased heart rate after going up a flight of stairs, or slight dizziness after standing up too quickly. These types of things can trigger significant anxiety, and that's because these sensations get misinterpreted as signs of a serious illness, leading to elevated fear and potentially panic. Now, through exposure, you repeatedly face these anxiety-provoking situations, allowing your body to get used to these physical sensations. And it's likely to feel really uncomfortable at first. So, for example, if you have health anxiety, exercise might make you really nervous because it increases your heart rate, and you might fear that that could be a sign of a health problem. But by gradually incorporating more physical activity and exercise into your daily routine and experiencing that elevated heart rate in a controlled way, you learn that these sensations are normal and not harmful or dangerous. Over time, you start to become more tolerant of these sensations because they're more familiar due to the exposure. And these sensations that once caused a lot of distress, they start to feel a lot less scary. And this doesn't mean that the sensations go away, but rather you become a lot less reactive to them. Through exposure, you learn that anxiety, while maybe uncomfortable, isn't dangerous, and it's something that you can manage and you can deal with. Planning and then doing exposure is kind of like building a muscle. Each time you do an exposure and successfully face a feared situation, no matter how small, you gain a little bit more confidence in your ability to handle anxiety. And again, this isn't about diving headfirst into your biggest and most intense fear scenarios, but rather taking small, doable steps that gradually increase in difficulty. So, for example, if you're terrified of going to the doctor, your first step might be something small, like driving by the clinic or calling to ask about available appointment times without actually booking an appointment. And as you succeed with these smaller steps, your confidence builds and you feel like you can take on more challenging tasks, like actually booking an appointment. Each success in the exposure process reinforces the sense that you can manage your anxiety and it doesn't have to control your life. And over time, these small victories, they begin to add up and they lead to significant improvement in your ability to manage health anxiety. So, in order to understand how exposure works, it's important to understand how avoidance works. When we're anxious, our natural gut instinct is to avoid the things that make us feel anxious. And in doing so, we feel safer in the moment, safe in the short term. From a biological perspective, avoidance is often driven by a part of the brain called the amygdala. And that's the part of the brain that's responsible for processing emotions. When we feel threat or danger, the amygdala activates our fight or flight reaction. And this can lead to all sorts of physical sensations, things like accelerated heart rate, sweating, rapid breathing, muscle tension, all sorts of physical sensations that make our body temporarily stronger or faster to fight or run away from a danger or threat. But these are also physically uncomfortable sensations. So, by avoiding the feared situation, we temporarily escape these unpleasant physical sensations. The problem is that by avoiding, we don't give ourselves a chance to see that the avoided situations aren't as dangerous or threatening as we think. And over time, this avoidance can make our world smaller and smaller, and the avoidance can convince us that we're not capable of handling these feared situations. So, for example, imagine that I avoid all types of medical buildings because I'm terrified that I might catch an illness. I stop going to checkups at my doctor's office. I might avoid hospitals. I might even stay away from the pharmacy. And so, while this avoidance behavior may help me feel better in the short term, the problem is the anxiety keeps coming back, often stronger. Because now I might start worrying about all of the medical conditions or the diseases I might be missing because I'm avoiding medical care. So I might start worrying about maybe there's something here because I haven't seen my doctor in 2 years. So the idea is rather than avoiding, what we want to do is to gradually face our health anxiety fears in a step by step, gradual fashion as a way of reducing anxiety and building confidence. And this is where graduated exposure comes in. And you can think of graduated exposure like climbing a step ladder, where every rung on the step of the ladder represents a small bit of exposure that brings you a little bit closer to confronting what it is that you're afraid of. So the idea is you don't start at the very top of the ladder because that would be overwhelming. Rather, you start at the bottom of the stepladder, where a little bit of exposure may feel anxiety provoking but manageable. And then you're able to slowly work your way up. So imagine I avoid any places where I think people might be sick, like doctor's offices or walk in clinics or the medicine aisle at my supermarket. But my ultimate goal is that I want to be able to make an appointment with my doctor to be able to have a checkup, which I haven't been able to do in a few years because I've been so avoided. But just the thought of going to my doctor's appointment makes me really anxious. That's my anxiety through the roof. And so jumping straight to that would be way too overwhelming. So what I need to break that down into more manageable steps that I'm actually capable of doing. So, my first step might be simply to go into the medicine aisle at my supermarket and to stay there for a few minutes. I don't need to touch anything. I don't need to talk to anyone. I don't need to ask the pharmacist anything. I just stand there looking around and feeling whatever anxiety I'm feeling. And over time, what happens with exposure to these types of situations is that my anxiety will come down by itself without me having to do anything about it. And so what happens is I become a little more comfortable just standing in the medicine aisle. And I keep doing that until that no longer causes me a lot of anxiety. That's the first step of the ladder. And so maybe the next step of the ladder is to touch something in the medicine aisle, or maybe to talk to the pharmacist and ask for recommendations around cold or flu medicine. And once I can do that comfortably, I then move on to the next step, which may be to visit a larger pharmacy, or maybe it's to walk past a walk in clinic. Maybe it's to call my doctor's office to ask about available appointment times, etc., etc. So, there are a couple of key benefits to doing gradual exposure. And the first is that gradual exposure works by a process that we call habituation. And in habituation, what happens is that repeated exposure to the same stimulus leads to a decreased response and a decreased emotional response over time. When you repeatedly face your fears in small, manageable doses, what you're doing is you're teaching your brain that the feared situation isn't as dangerous or threatening as you thought it was. And over time, the emotional intensity associated with your anxiety and fear goes down, and that makes the exposure step easier to tolerate and then allows you to go on to the next exposure step. The other benefit of gradual exposure is that it allows you to challenge negative beliefs about the feared situations themselves. For a lot of people with health anxiety, they can experience distorted beliefs about their abilities or the potential consequences of certain actions or behaviors. And by facing these fears in this structured, graduated way, What a person is doing is collecting evidence that can help challenge or contradict these overly negative beliefs. Essentially, by doing the gradual exposure, we're collecting information about how dangerous or safe a situation is, and that's the stuff that avoidance prevents us from learning. So we know that gradual exposure works. And so the question is, how do you go about building an exposure stepladder or an exposure hierarchy? What you want to do is to start with and to start thinking about what is the ultimate situation that you want to stop avoiding. In the example we talked about earlier, maybe it's I've been avoiding having a doctor's appointment. Whatever it is, that's the top of my fear ladder. Now, the next thing to do, once you've identified the top of the ladder, is to think about all of the steps that I could take to work towards that ultimate goal. Think about things like who might be in that situation? What exactly am I doing? When am I doing it? Where will I be doing it? How long am I going to stay there? By asking these questions, what I'm able to do is to think about smaller and less intimidating or less anxiety provoking steps. The idea is to make each step feel a little bit more challenging, but not so overwhelming that it causes so much anxiety that I can't follow through and can't do it. And one way to make sure that each step is manageable is by um, ranking each step on a distress rating scale. So on a scale from 0 to 10, where 0 is no distress or no anxiety at all, and 10 is extreme anxiety. And so the idea is to put a number rating on how anxious each step is, and then rank ordering the steps from least distressing or least anxiety provoking to most distressing or most anxiety provoking. So in my example, standing in the medicine aisle of the supermarket for a few minutes might start out as a 3. And as I move up the exposure hierarchy, each step gets more challenging, where walking past a walk-in clinic might feel like a 4, and calling my doctor's office to inquire about an appointment, that might feel like a 6, until ultimately making an appointment to see my doctor could feel like a 10. And the key here is to repeat each step in the hierarchy over and over and over again until your anxiety at that level goes down before you move on to the next step. And the more you do this graduated exposure to these feared situations, the more you start to recognize that your anxiety doesn't last forever. It reaches a peak and then it gradually declines. And the more you do this type of exposure, the lesser the anxiety peaks and the more quickly it goes away. So it's important to recognize that this is a process that takes time. And you might feel tempted to want to rush through the exposure and the exposure ladder because you want to overcome your anxiety as quickly as possible. But it's really important to resist that temptation. You may feel like you're moving up the ladder really slowly, but the key is to make sure that your anxiety goes down before you move on to the next step. And if you have a setback when your anxiety goes up for some reason, that's okay too. Sometimes you may have to repeat this step over and over and over again, or even take a step back to build up your confidence again. And that's okay. The important thing is that you're continuing to challenge yourself and continuing to do exposures. So the idea of graduated exposure is really about taking small, manageable steps, facing your anxiety and staying in it, even when it feels uncomfortable. It would be great if exposure worked really quickly and that you could overcome your health anxiety overnight. But unfortunately, that's not how anxiety works. But with patience, practice, and commitment to this exposure process, it will have a huge impact on helping you overcome your anxiety. So the first thing you need to do is to plan your first step. You've identified all of the steps in your ladder and you're at your first step, but where do you go from here? How do you take that first step? Well, what can be helpful is to set a specific date, a specific time and a place that you're going to do your first exposure. And what this does is it gives you a clear plan and makes the process feel more concrete. So for example, if my first step in the exposure ladder is to stand in the medicine aisle at the supermarket, I might decide that I'm going to do that on a Saturday at 10 a.m. and I'm going to do it for 5 minutes. The more specific I make the plan, the better, because it's easier to follow through and it helps hold me accountable. One of the key ideas is to ensure that you start small. Now, it might feel like a waste of time to tackle something that seems really easy at first, but it's the small steps that are the building blocks of exposure. The small first steps that get you used to the discomfort and the anxiety that comes with exposure. And so when you face more and more difficult situations, you're better prepared. It's important to remember that each step in the exposure ladder is designed to help you collect evidence that helps you challenge those health anxiety provoking thoughts and helps you build your confidence to move on to the next step. So it's important to understand, let's be really clear, you'll likely feel anxious when you take that first step in exposure. That's entirely expected. In fact, the goal of exposure isn't to avoid anxiety, but to experience it and to get used to it. When you expose yourself to something that you're anxious about, it's natural for your anxiety to go up at the start. But the longer you stay in that situation, your anxiety plateaus, and then it eventually goes down by itself. You don't have to do anything about it. It will just go away naturally. So you can think about it like riding a wave. At first, the wave might seem overwhelming, but if you can ride it out, the intensity of the wave eventually decreases, and that wave of anxiety eventually passes. And the more you do it, the more you learn, and the more you're teaching yourself that anxiety isn't dangerous. It's uncomfortable, yes, but it's not dangerous, and it's something that you demonstrate to yourself that you can actually handle. So if I'm working on overcoming health anxiety or health fears related to contamination, my first step might be to stand in the medicine aisle of the supermarket without touching anything for 15 minutes. The idea is that I need to remind myself that I'm likely to feel increased anxiety in the moment that I step into the medicine aisle, but my goal is to stay there for long enough that I start to experience the anxiety going down. This may take a few minutes, but eventually I start to notice that the initial wave of anxiety starts to fade. And the key thing is that you need to stay in the situation until your anxiety begins to go down. If you enter the situation, your anxiety goes up, and then you leave the situation at the peak of your anxiety, what you tell yourself is that the situation was really dangerous and that you needed to escape it, which just makes it even harder the next time you try to do exposure to that same situation. We call this sensitization. So to avoid sensitizing yourself, what you need to do is you need to stay in the anxiety situation until the anxiety starts to go away on its own, which it will. You just need to give it some time. Now, another important part of this exposure process is reducing or eliminating what we call safety behaviors. Sometimes when we do exposure to feared situations, we do so with certain precautions or safety behaviors, safety nets that we set up for ourselves. So for example, I might carry around hand sanitizer everywhere just in case I brushed by something, or so I can immediately sanitize my hands and feel better. Once again, this type of behavior might be comforting and relieve my anxiety in the short term, but these types of safety behaviors prevent me from fully facing my fears, which is what I'm trying to do with exposure. So if I'm in the medicine aisle of the supermarket, I might find myself there with hand sanitizer in my pocket, or I might avoid touching any of the items on the shelves. So the idea is for me to start challenging the safety behaviors by doing things like leaving hand sanitizer at home when I go to do the exposure, or pick up different products off the shelf and reading the label as part of my exposure. And what this does is it helps expose me more fully to my fear of contamination in a controlled and manageable way. And if you find that dropping a particular safety behavior feels too hard at first, that's okay. You can gradually reduce it over time as part of the graduated nature of exposure. So for example, if I'm always used to carrying hand sanitizer, maybe what I do is I go out with the hand sanitizer for a short period of time and then gradually build up the amount of time that I'm leaving the house without hand sanitizer. So the idea of graduated exposure and eliminating safety behaviors is about doing it in a structured, gradual, one-step approach, one step at a time approach. This isn't about leaping to the top of the ladder. So we start at the bottom of the ladder with what seems like the least difficult step, and you work your way up. As you move up the exposure ladder, your distress ratings for each step will increase, but the more you do exposure to these situations, the more you get used to that anxiety, and the more you recognize that you can handle it, and the less daunting the next step feels. The key is to repeat each step again and again until it feels manageable. You may need to go over the same step multiple times before you're ready to move on. You might find that you do it so often that you get bored. And if you do find yourself getting bored, that's a good sign that you're ready to move on to the next step. Because anxiety and boredom can't exist at the same time in exposure. And so it's important to repeat each exposure step again and again until the step in the ladder doesn't really cause you very much anxiety and you move up. Repetition is crucial because it helps you feel more in control when you're doing the exposures. If you do a step only one time, the anxiety might tell you that you only got through it by luck, or it's not going to go as well the next time. But the more often you do the exposure at that step, the more you're collecting evidence that you can do it and that the anxiety isn't so bad and that you can manage the anxiety, which then helps reduce the anxiety of every step. And you might be wondering, what happens if something goes wrong while I'm doing exposures? Maybe I attempt an exposure at a step and it doesn't go as well as I had thought. Maybe I feel overwhelmed or so anxious that I can't stay in the situation and I have to leave. Well, it's important to recognize that setbacks are a normal part of this exposure process. So if you find yourself in a situation where a particular step feels too hard, what you might need to do is to create a bridge step, which is an exposure that fits in between the step that you're struggling with and the previous step that you've been able to successfully do exposure to. So for example, if I find it too overwhelming to visit my doctor's office, what I can do is to create a bridge step, like going to a walk-in clinic and sitting in the waiting room of the walk-in clinic until I feel less anxious. The smaller bridge step can help build my confidence to then allow me to take that next step of actually visiting my doctor's office once I've become more comfortable with sitting in the waiting room of the walk-in clinic. Another thing you can try to do when faced with a setback is to go back to a previous step and redo the exposures at that level. Once again, what you're doing is you're building your confidence and you're getting used to experiencing anxiety in a controlled way that doesn't get out of control where you feel like you have to escape. The key thing is that you keep moving forward and keep doing exposures, even if it's at a slower pace than you had planned or at a slower pace than you would like it to be. You don't want to rush through exposures, but at the same time, it's important to keep pushing yourself to do exposures to make sure that you're moving up the exposure ladder. And one thing you can do that can help motivate yourself as you do these exposures is to recognize and to acknowledge your successes. Every time you complete an exposure step, what you're doing is that you're proving to yourself that you are capable of facing and overcoming your anxiety. So every once in a while, make sure you take a moment to think about how far you've come with the exposures. You might find that something you considered would have been impossible a few months earlier is now something that you can do with relative ease. And by reflecting on that, it can be a source of motivation to think about where you could potentially be in another few months if you continue with the exposures. Now, many of the rules that we have about our health stems from early life experiences. Think about people in your life when you were growing up. How did they react when you were sick? Did your parents rush you to the doctor for every little symptom, every little time you had a sniffle, every time you had a fever? Maybe you had a parent who was constantly checking on your health, or had a family member who was always anxious about their health. Or were there people in your life who were more laid back about issues related to their health or your health? These experiences can have a big impact on the way that we think about our health later in life. Over time, these experiences or lessons that we learn at a young age form assumptions or rules in our mind, even if we're not fully aware of them. For example, you might develop a belief that I must take every symptom seriously, or something awful is going to happen. Or something like I should never ignore my bodily sensations because they could be a sign of something seriously wrong. At first glance, these beliefs may seem good and helpful, but in reality, what they're doing is they're setting you up for constant worry about your health. So it's important to recognize that not all health rules are bad. In fact, we need certain rules to keep us safe. These rules act as our internal safety net. They help us navigate the world in a way that feels comfortable and safe. So, for example, you might have the rule, I should stop at red lights. This is a helpful rule because it's based in evidence. If you don't stop at a red light, you could get into an accident. The rule serves a clear purpose. It keeps you safe while driving. It's a straightforward rule and it's based on logic. Another example is something like, it's good to wash your hands after touching raw meat. This makes sense because it helps prevent the spread of bacteria that could make you or others sick. These types of rules are useful because they're realistic, they're practical, and they help us manage real risks without unnecessary anxiety. But what happens when the rules that we create for ourselves around health are unrealistic or rigid? That's when these types of rules can cause a lot more harm than good. So, for example, something like, I should never feel any unusual sensations in my body. At first, this might seem protective and helpful, but in reality, it's an impossible rule to live by. Because our bodies are constantly giving us feedback in the form of physical sensations. And most of these physical sensations are totally harmless. You might feel an ache in your back after sitting for too long. You might get a headache because you're dehydrated. You might get a flutter in your chest when you're feeling anxious. Most of the time, these types of sensations aren't a big deal and they go away relatively quickly on their own. They're not a sign of something serious. But if I have the rule that says I must be symptom free at all times in order to be healthy, then every small twinge of discomfort or every physical sensation now becomes a health crisis. Think about it. How many times have you woken up with a sore neck or a sore back and just brushed it off? Now imagine you hold the rule that tells you that the sore neck or back is a problem that needs your immediate attention. What started out as a minor bit of soreness now becomes the focus of your day. Instead of just noticing the sensation and moving on, you might start thinking to yourself, what if this is something like MS and my body is starting to deteriorate? You might start to Google the symptoms, read about worst case scenarios, and suddenly that little bit of neck or back pain, that spirals into full-blown health panic. And these unhelpful rules don't just create anxiety, they also have a way of affecting other parts of your life. Think about the mental energy that it takes to constantly monitor your body for any signs of problem. When you hold the belief that you must always be symptom free or that every physical sensation needs to be explained, you set yourself up for a never ending cycle of worry. And think about the impact that has on your daily life. You might find yourself making frequent doctor's appointments, not because something's wrong, but because you're constantly seeking reassurance that nothing's wrong. You might spend hours researching symptoms on the internet, diving deeper into all sorts of worst case scenarios. We call this hypochondria. It's the anxiety you feel when you try to self diagnose based on stuff that you read online. And so while it feels like you're gaining control by seeking information, the frequent doctor visits and internet research just leads to more worry and more confusion. And over time, these unhelpful rules can also start to affect your behavior. You might avoid certain activities because you're afraid that they'll bring up physical sensations and make you feel worse. For example, you might stop exercising because the feeling of fatigue or muscle soreness afterwards makes you anxious that you have some sort of degenerative muscle condition. Or you stop drinking coffee because it causes you to notice that your heart rate increases, which makes you worry that maybe you have heart disease. These avoidance behaviors can then have a significant impact on your life. This avoidance leads to you missing out on things like spending time with friends or doing hobbies or even just being active, all because you're holding on to a rule that says, I must be symptom free at all times, or I need an explanation for every body sensation. So these rules trap you in a constant state of hypervigilance where every small sensation becomes something that you need to investigate, that you need to avoid, or that you need to worry about. And over time, this doesn't just make your anxiety worse, it can also make your world smaller as you avoid more and more things that you used to enjoy. And your life becomes centered around managing these health fears rather than actually living. So while these health rules are meant to protect us, when they're rigid or unrealistic, they end up doing the opposite. Instead of keeping us safe, they keep us trapped in a cycle of anxiety, limiting our lives and making us feel awful. So, how can you start recognizing whether you have some of these unhelpful rules? Well, a good place to start is to start by asking yourself a few key questions. What standards do I expect of my health? Do I expect to always feel perfect or symptom free? What do I expect from my doctor? Do I expect them to explain every symptom and to always have an answer for everything I'm feeling? Do I allow myself to experience certain physical sensations without worry, but I panic over other sensations? These questions can help you recognize some rules and assumptions that might be affecting your thoughts and your behaviors and ultimately your anxiety. And once you start to recognize these rules, you can then begin the process of challenging and changing the rules. Now, the first step in adjusting health rules is to recognize which are the biggest ones, the ones that are causing you the most anxiety. Maybe you can think of one off the top of your head, something like, I must always be symptom free to be healthy. Or if my doctor can't explain a physical symptom, then it must be something serious. These types of rules put you in a constant state of heightened alert, and they make every little sensation feel like a potential crisis. So, once you've identified the unhelpful rule, what you want to do is to try and think about where that rule might have come from. This part of the process is about understanding where these health beliefs came from and why you've held on to them for so long. A lot of the time, these health rules come from a place of protection. So, for example, maybe you grew up in a family where any illness, no matter how small, was treated as serious. Maybe every time you had a cold, your mom rushed you to the doctor. In that context, you might develop a rule like, I must take every symptom serious to protect myself. It made sense at the time, and it might have even felt helpful back then. But now you may be able to see more clearly that the rule might be causing more harm than good. It's causing you to feel anxious about every small sensation that could be leading to constant doctor's visits or endless research about symptoms online. So while it might have once served a purpose, it's not really helping anymore. So the next step in the process is to challenge the unhelpful rule you've identified. Now, it's not uncommon for this part to feel uncomfortable because these rules are probably deeply ingrained. You may have had these rules for a long time, and they've shaped how you view your health and how you respond to physical sensations in your body. But by questioning these rules, you can begin to start seeing them for what they really are: unrealistic, anxiety inducing beliefs and assumptions. So, to challenge these beliefs, one of the first questions to ask yourself is this rule even achievable? So, for example, if I hold a rule like, I must always be symptom free to be healthy, what I want to do is to ask myself, is that even realistic? And the answer to that question is no. Our bodies are complex, and we experience sensations and little aches and pains every day. And the vast majority of these are completely harmless. You might have muscle soreness from an intense workout. You might have a headache from dehydration. You might have indigestion from eating too fast. None of these are signs of illness. It's impossible to expect your body to be free of sensations all the time. It's an unrealistic standard that just sets you up for disappointment and anxiety because your body's always going to change and you're always going to experience these sensations. By recognizing and questioning whether the rule is achievable, you start to see how setting such an unrealistic expectation can cause and lead to anxiety. The next thing you want to ask yourself is this rule helping me live a better life, or is it keeping me stuck in anxiety? Often, what you'll find is that you have rules that actually do more harm than good. So, for example, if you believe, if my doctor can't explain a sensation, then something must be seriously wrong, this rule might lead you to mistrust your doctor. You might feel frustrated after every visit if they can't provide you with a definitive answer. And then that reinforces your anxiety and makes you feel like your doctor's missing something. But the reality is, even doctors don't always have the answers for every minor sensation or every change in our bodies. And that's okay. We don't always have to know the cause of a physical sensation. You may also want to ask yourself whether your doctor or even the people around you may hold these same types of rules. Does your doctor expect to be able to explain every single body sensation? The answer is probably no. Doctors tend to look at the bigger picture. They know that some symptoms aren't a big deal and they aren't a cause for concern. That doesn't mean they're neglecting your health. It means they understand that the body's complicated and that some sensations simply aren't signs of danger. By recognizing that even doctors don't live by these rigid rules, you can begin to start to let go of them yourself. And once you've challenged the unhelpful rule and recognized how damaging and unrealistic the rule is, the next step is to think about it as something that's more balanced and realistic. The goal here isn't to drop all of your health rules entirely, but rather to tweak and adjust them so that they can better reflect what's really going on and reality itself, and to allow yourself to live with less anxiety as a result. So let's go back to the rule: I must always be symptom free to be healthy. A more realistic version of that rule might be something like, it's normal to experience occasional aches and pains or sensations in my body, and most of them are harmless. Now, notice this new rule still acknowledges that the sensations will happen, but it removes the impossible expectation of being symptom free at all times. And this flexibility is important. It allows you to move away from rigid thinking and instead approaching your health from a more more of a perspective of curiosity and acceptance rather than viewing every symptom as a potential crisis. And you can start seeing these symptoms as a normal part of being human rather than dangerous. Another helpful technique to rewrite these health rules is to change the endings of if then statements. So, for example, instead of thinking, if my doctor doesn't know what's wrong, then it must be serious, the idea is to reframe it as, if my doctor doesn't know what's wrong, it's still probably not anything serious, and it's likely going to go away on its own. This simple shift in language helps acknowledge the uncertainty of the situation, but not automatically assuming the worst. And once you've rewritten the health rules, the next step is to put these new, more flexible and realistic rules into practice in your everyday life. And this step requires you to repeatedly remind yourself of the new rule when old thoughts and fears start to creep back in. So imagine you're going about your day and you suddenly feel a strange sensation in your chest. Previously, you may have immediately jumped to the conclusion, I must be symptom free, something must be wrong. But the idea here is to catch those thoughts and replace them with the new rule, which is something like, it's normal to feel sensations in my body, and most of them are harmless. This mental shift helps interrupt the anxiety cycle and allows you to get back to whatever you were doing without getting stuck in a health anxiety worry spiral. It's also helpful to think about things that you can do behaviorally to reinforce your new rules. For example, if you've avoided exercise because you were scared that physical activity would bring up physical sensations that would make you anxious, the idea is to start with lighter activities like going for a short walk or doing light stretching. And by gradually reintroducing these types of behaviors into your life, they can help reinforce the idea that discomfort is a part of being active and that's okay. And as you continue practicing these behaviors and continue to repeat your new rules to yourself, your new rule will start to feel more natural and more true. And over time, it will become a normal part of how you react to health related thoughts and sensations, and that will help you reduce the impact that health anxiety has on your life. Let's start with an old model, a typical model that people will have in terms of their health that contributes to health anxiety. Imagine health anxiety as like a wheel that's spinning in one direction. It's a cycle that feeds itself, and once it gets going, it can almost feel impossible to stop it. And this cycle begins with a trigger, something internal, a physical sensation like a headache or a racing heartbeat, or it can be external, like hearing about a friend's illness or seeing a news story about some sort of disease. These triggers are normal, they're common, everybody experiences them from time to time. But for someone with health anxiety, what these triggers do is they activate unhelpful health rules and assumptions. And these health rules and assumptions are often beliefs that we've developed over time, often without even realizing it. So, for example, maybe you grew up in a household where every minor symptom was treated as a potential emergency. Or maybe you've had a personal experience with an illness that left you feeling vulnerable. Over time, these experiences can shape our beliefs. Any pain becomes a sign of something serious. I must always be vigilant about my health. If I don't catch an illness early, it's going to be too late. And once these beliefs are activated, they then shape how we interpret the trigger. A headache isn't just a headache, it's a brain tumor. A cough isn't just a cough, it's lung cancer. And it's these interpretations that fuel anxiety. And the more anxious you feel, the more you tend to focus on the symptoms. And so you might start checking your body for signs of illness. You might start Googling symptoms or seeking reassurance from doctors, friends, or family. In the short term, these behaviors might give you a sense of relief or control, but in the long run, what they do is they just keep that health anxiety wheel spinning. And this is why, because when you check your body, what it does is it might make you notice more sensations, which you would then interpret as signs of more danger. So for example, if I'm constantly checking my pulse, I might start noticing that every little variation, I might start noticing every little variation in my heartbeat, even though these variations are normal. They happen all the time. Seeking reassurance might temporarily calm my fears and reduce my anxiety, but it also reinforces the idea that I need someone else to tell me that I'm okay. Avoiding activities that remind me of my health fears, like going to my doctor or watching medical shows, these limit my ability to challenge those fears, that anxiety. And so over time, this cycle becomes self perpetuating. The more I engage in these behaviors, the more anxious I feel, and the stronger that health anxiety cycle becomes. So that's the old model of health anxiety. Let's talk about a new model for understanding our health and health anxiety. And the good news is this cycle can be reversed. So imagine that wheel again. If you push against its motion, it might be resistant, might be hard at first, but with persistence, that motion, that wheel, can start to spin in the opposite direction, just like it does with health anxiety. These triggers, the triggers that start the cycle, they're going to still happen. After all, life is full of uncertainty. We experience physical sensations all the time. But you can then choose to respond in a different manner. In our new model of health anxiety, when a trigger activates our old health rules and assumptions, we don't let them dictate our thoughts and behaviors. Instead, you challenge them. You ask yourself, where did this belief come from? Is it realistic? What's a more helpful way to think about this? So, for example, if I catch myself thinking, this headache must be a brain tumor, the idea is I challenge that thought by asking, what's the evidence for and against this being a brain tumor? How likely is it really? I might remind myself that headaches are common and usually harmless, and that jumping to the worst case scenario isn't all that helpful. You also let go of focusing on symptoms by practicing attention exercises. These exercises can help shift focus away from your body and onto something else. So, for example, you might practice focusing on a mundane task like washing the dishes or folding laundry, and really paying attention to those sensations, the sounds, the movements involved. This is what we've talked about as mindfulness. You might also want to try meditation, which helps you observe your thoughts and sensations without getting caught up in them. You might want to try postponement, setting aside a specific time and place to worry so it doesn't consume your day or doesn't consume this moment. So, for example, you might decide that if you start worrying about your health, you'll write it down and revisit that worry during a 10-minute worry period later in your day. In our new model, we also reduce checking and reassurance seeking by asking, how helpful is this behavior? What's a better way to respond? So, for example, if you feel the urge to Google your symptoms, you want to ask yourself, what am I hoping to achieve by doing this? Will it really help, or will it just make me more anxious? And instead of doing that, you might decide to distract yourself with an activity that you enjoy, or you remind yourself of a time that you worried about a physical symptom and it turned out to be just fine. And finally, in our new model of health anxiety, you gradually confront the things you've been avoiding. This might mean going to a doctor's appointment without canceling, watching a medical show without changing the channel, or having conversations about health without seeking reassurance. And these behavioral exposures can feel scary at first, but they're essential to help break this cycle. Every time you confront a fear, you learn that you can handle it, and the fear loses some of its power. So at first, these changes might feel uncomfortable. It's like learning to ride a bike. You might wobble from the start, you might fall a few times, but with practice, it gets easier. And over time, your old health rules and old health assumptions begin to lose their power. You start to feel less anxious, more in control, and more confident of your ability to handle health anxiety and health concerns. That wheel spins in a new direction, and you're no longer trapped in the cycle. So the next time you feel that familiar feeling of wanting to check or worrying or avoidance, remember, you have a choice. You can change this cycle. You can keep that old wheel spinning, or you can push against it and create a new way of operating, a new way of responding. It's not easy, but it's really important and it can be really worth it because on the other side of all of this effort is freedom from the grip of health anxiety and the opportunity to live a fuller, healthier, less anxious life. So let's start with thinking about what some of the setbacks that could happen with health anxiety. Imagine that you're learning to play tennis for the first time. At first, everything feels awkward. The way you grip the racket, your stance, your swing, but with practice, it begins to start to feel more natural. And then one day you play against someone who's really good, you miss every shot, you feel like you're back at square one. So does that mean you should give up because it felt awkward again? It felt uncomfortable again? Well, no, it just means that you need more practice because you played against someone who was really good. It's the same approach, it's the same idea with managing health anxiety. Setbacks don't mean that you failed, they just mean that you're human and that this is a natural course of what happens as you're overcoming health anxiety. So, the idea is to prevent small setbacks from turning into major ones. And the first step is to recognize the early warning signs. And these are clues that might suggest to you or tell you that the health anxiety is creeping back in. Maybe you notice yourself checking your body more often, or you catch yourself Googling symptoms late at night. Maybe you start avoiding activities or places that remind you of your health fears, or you feel an increased sense of anxiety or nervousness about your next doctor's appointment. These are all potential early warning signs that the health anxiety is starting to creep back in and it may be time to take some action against it. And one of the most effective ways to prevent setbacks is to create your own self management plan. And the idea is this plan is sort of like a roadmap that helps you navigate or manage the challenges of health anxiety. And it includes three key components: the early warning signs, potential problem situations, and specific strategies to get back on track. So, the early warning signs, we've sort of touched on this. These are subtle changes in your thoughts, your feelings, and behaviors that might signal a setback is coming. So, you notice you're spending more time thinking about your health, that you're feeling more anxious than usual. Maybe you're starting to avoid certain activities or seeking reassurance from other people. By recognizing these signs early on, you can take action before that setback begins to gain momentum and begins to get bigger and bigger. The next thing you want to do is to think about potential problem situations. These are the potential triggers that could re-flare up your health anxiety. So, for some people, it might be a stressful time at work or a major life change like moving or starting a new job. For other people, it might be having a routine medical checkup or hearing about someone else's illness. So, these triggers can either be health related or non health related. But by anticipating these situations, you can prepare yourself to handle the stressors and these triggers in a healthier way. And then there's the self-management plan. And the self-management plan should include strategies and techniques for getting back on track. So the self-management plan is using all of the tools you've learned as you've learned how to overcome and manage health anxiety. Things like challenging unhelpful thoughts, practicing attention exercises, reducing checking and reassurance seeking behaviors. You might want to include coping statements in this plan, phrases that remind you of your progress and to help you stay sort of grounded and on track. So, for example, you might tell yourself, I've handled this before and I can handle it again. Or this is just a temporary setback, not a failure. It doesn't mean the health anxiety is coming all the way back. And then there's the idea of healthy living. Because overcoming health anxiety isn't just about managing your health anxiety thoughts and behaviors. It's also about improving your overall quality of life. After all, if you've taken steps to improve your health, you'll have less to worry about. The health anxiety will have less grip. And healthy living, it's not just about eating healthy and exercising. It's about creating a balanced lifestyle that supports both your physical but also mental and social well-being. So, social activities and support. You want to ask yourself, do you have a strong network of friends and family that you can rely on? And if you don't, how can you go about building one? How can you go about increasing your social support? Maybe you could reach out to an old friend for a coffee or join a club or a group that interests you. Social connections are really, really important for mental well being. They buffer against stress and anxiety. And so it's really important that you make sure that you have regular social contacts and that social support. You also want to consider stress and the impact that stress has on you. Are there areas of your life where you notice that stress is piling up? Work, relationships, financial pressures. When you recognize these stressors, you want to think about how you can go about reducing those stressors. Maybe it's setting boundaries with people. Maybe it's practicing relaxation techniques. Maybe it's carving out time for activities that you enjoy doing. You also want to focus on diet and exercise because these are really important parts of healthy living. Are you eating a balanced diet that is healthy, that fuels your body? If not, what are some of the small changes that you can make to improve your diet? Maybe something as simple as just adding more fruits and vegetables to your meals, or maybe you cut back on caffeine. What about exercise? Well, regular physical exercise is one of the most effective ways of reducing anxiety and improving mood. It doesn't have to be intense. Even just a daily walk can make a big difference. So you want to make sure that you're getting some exercise in addition to those healthy diet, healthy eating habits. Fun, relaxation, these are also important components of a healthy lifestyle. When was the last time you did something just for the enjoyment of it? Reading a book, playing a sport, uh, engaging in a hobby. It's important to make time for activities that you enjoy, that bring happiness, that are just fun. You also want to think about sleep habits. Are you getting enough sleep? Are you getting enough rest? If not, what are some of the changes you can do to improve your sleep? Maybe it's about creating a bedtime routine. Maybe it's limiting screen time before bed. Maybe it's making your bedroom a more relaxing, comfortable environment. So the idea here is when we're overcoming health anxiety, one of the ways of maintaining that progress is to make sure that you're focusing on overall health, not just the things you need to do to reduce health anxiety. You're building a life that is self-fueling and self-maintaining. And in doing so, it's more fulfilling and more meaningful. And when setbacks happen, as they will, because setbacks are a part of recovery, you'll have the tools and the resilience to be able to manage those setbacks. So there you have it. If you've made it this far, you've seen how health anxiety can pull you into endless worry. and you've also seen how to find your way out. The patterns of checking, reassurance seeking, and scanning for danger can feel automatic, but they don't have to stay that way. You've seen tools for slowing down, questioning anxious thoughts, and practicing healthier ways of responding so that health anxiety doesn't keep dictating your choices and dictating what you do in your life. Recovery from health anxiety isn't about never feeling health worries again. It's about building confidence that you can handle the uncertainty and still live your life. These strategies that I've talked about, they work best when you actually use them, when you experiment, and when you give yourself room to learn and try these out. Progress may not be a straight line, but every step you take is a step forward to overcoming health anxiety. Hopefully what this video has shown you is that you don't have to be stuck with the patterns that health anxiety creates. You can change them, and with enough practice, those changes can start to hold. And if you're interested in learning more about other ways of managing worry, I'd encourage you to check out this video. So that's all for today's video. As always, thank you for making it all the way to the end of this video, and I will see you in the next one.